Keeping you informed, KUAM News brings you Banking 671, brought to you by the Bank of Guam, the People's Bank, and Coast 360 Federal Credit Union. Together, we thrive.
KUAM News COVID-19 Takeover on I-94 FM is presented locally by Ambrose Inc.
GU Self-Storage, conveniently located near the Harmon McDonald's. We offer affordable rates, online payments, and auto bill pay for your convenience. Plus gate access daily from 6 a.m. to 9 p.m. Call us today at 648-7867 for more information.
With the new challenges we're all facing, First Hawaiian Bank wants to make sure you have access to your financial world. With FHB Online and our mobile app, we hope to make banking the least of your worries. Visit fhb.com/digital.
Be healthy. Be informed with ITD. Be healthy. Be informed with ITD.
time for us versus them.
Panogita moru purita nonda kantai mantunat nyagi toru iluga.
GMH Administrator Lillian.
University of Guam, Dean of Nursing, Margaret.
There is light at the end of the tunnel.
Help is on the way from a marine medical.
Contrai peligro na fansafuham Deus protegis languam.
Out in the public, where all are more exposed.
585 have tested positive.
Protegis languam. It's amor, puri americano. Let's see how sabulets Dala pakai lasasnya Taiga purilu Agagazana marizu Besas buatilu Mapusito milu Oaso haunai hauni Ai pendea Agu amatat saki Sati usumu Nama usa Zapusa Kanidosa Minum lemma soda Yan zan fetada Atu hausa pumoksay Chamoru na sintara Malafa hauni costume Todo ilegagi Nasa fuatilo Apusito milo Oasu haunay haunay Ay pendea.
Man, you know, this should win a Grammy for best use of Woody Woodpecker laugh. Oh, that went. Hey, good morning. I know my Facebook livers, they know Woody Woodpecker. They just had a movie about it. They remade it. Now my kids like Woody Woodpecker.
I didn't know that.
Yeah. I know you don't really watch many movies.
Don't really have time.
You check it out. They kind of like 2000 it, so there's like an environmental theme with Woody Woodpecker and the evil loggers are trying to tear down his habitat, and then hijinks ensue, is how I'll say it.
I gotta watch this.
Yeah, it's a good one. Well, good morning on you, Guam. It's 6:19, May 14th, PCOR 2, the land of zero positives. COVID has left the building, apparently. Good morning. Again, it's the KUAM News Takeover, Guam's favorite I-94, containing COVID, and it's all proudly brought to you by Cabo Enterprises, IT&E, Ambrose, Coast 360, and the Bank of Guam this morning. As always, a great, big, jam-packed show for you guys on containing COVID. We're going to talk with the CCU this morning as they are opening up. Yep, they know you got those stimulus checks. So we're going to talk to Simon from CCU and find out how they're opening with the use of the mask and the social distancing and all that stuff. And we'll get to who's going to come on the show in a little bit. But thank you and good morning to everybody watching on our KUAM News Facebook page. The award-winning KUAM social media. Good morning. Also on our live stream, KUAM.com, the KUAM News app, there's an audio stream, Docomo Channel 10, and right here on the radio, 93.9 KUAM FM Agotnia at 6:19. Let's dive into the day's COVID-19 headlines from the KUAM News team with the very latest. Sabrina Salas-Metanati, good morning.
Day, good morning, everyone. The latest from the Joint Information Center, released just before 10 o'clock last night. 87 individuals were tested for COVID-19. On Wednesday, 0 tested positive. The results include samples from clinics, the Guam Memorial Hospital, the quarantine facility, and samples from the COVID-19 expanded testing at St. Dominic Senior Care in Barragata Heights. The number of confirmed cases remains at 152, 5 deaths, and 124 released from isolation. Expanded testing in the meantime will be held this Friday at Gura Public Housing in Lower and Upper Agate and Maritzo. The testing is for those with COVID-19 symptoms, including multi-generational families. It is free and is from 9 a.m. to 12 o'clock in the afternoon. You are urged to bring an ID. The Department of Administration Director, Edward Byrne, has got his marching orders and firing up the computers to push electronic checks to vendors for their efforts in containing COVID.
DOA Director Edward Byrne got his orders from Governor Lulian Guerrero.
There is a formal instruction I have.
The formal instructions came via a memorandum signed by the governor last Friday, May 8th, citing her Title X special powers, allowing her to make emergency purchases to respond to a public health emergency.
I know that we're having to do things in a different way, all of us, right, because of this pandemic.
Different in that invoices are being paid even though signatures are missing on several emergency purchases that were posted on the governor's website. Matter of fact, every emergency purchase on agreements between Guam Homeland Security and the Office of Civil Defense for the quarantine isolation facilities are missing the signature of the agency's director, Charles Esteves, certifying officer Marie Kenga, BBMR Director Lester Carlson, the Attorney General, and the governor herself. What was attached to every agreement was the May 7th memo stating the governor's Title X special powers.
So these don't have to have contracts, right? Just as long as you got the invoice, you don't have any other you don't have to have any other paper trail justifying anything, like no agreements are in place. It's okay just as long as the governor says, go pay this. And here's the invoice.
This was an emergency procurement.
Right. Well, I'm just curious because Charles Esteves said, where's the contract when it came to Mr. Hyun sending over information about these food contracts, and Esteves is like, where's the contract?
Byrne was firm that he's received his orders.
I think it was like at the end of last week, I got an instruction from the governor to pay these invoices that were acquired under this emergency purchase.
Although Byrne didn't provide specific details about which invoices or how many he's paying, according to the governor's website, there are multiple emergency purchases and multiple agreements between GHS OCD for quarantine isolation facilities, beginning with Santa Fe. UNI are paying for 103 fully furnished rooms, Perlis Court condominiums, 17 fully furnished condos, Pacific Star, 389 rooms, Days Inn, 48 rooms, and Wyndham Garden, 144. According to these agreements, we're paying $100 per room per day, and even if they're vacant. The hotels are to take care of housekeeping, linen and towel service, providing their own labor and personnel, as well as the quarantine isolation hotels are responsible for delivering and providing 3 meals a day, 7 days a week. But if food services are part of the deal, why is there invoices on the governor's website to pay almost $80,000 to Capital Kitchen?
I think it does include food for those people that are staffing the hotels, but I don't think it's every meal. I think it's just, whenever those staff are there, we paid for the meals for the people that are helping the people in quarantine.
Also paid was an invoice for laundry services from a company called The Laundry Solutions. But it wasn't the governor that gave the order, but rather her now former chief of staff, Tony Babalta.
Is she the only one who can tell you that? Because you said Tony Babalta also did. Is she the only one? And who else has?
Nobody else has.
So just Tony Babalta and the governor have ordered you to...
The governor is the governor, right?
Well, Tony Babalta was Tony Babalta. He's not the governor. But he said he called you up or he wrote something. Did he call you or did he write something and tell you to pay?
No, I think he called me.
Can you recall the call, Ed?
No. But let me just say this, and this is important, right? That if the instruction I have got from the governor was to pay whatever invoices were presented, and that means invoices that were presented and paid, and invoices that are yet to be paid.
UNI, in the meantime, will also be paying for medical staffing at the quarantine isolation sites. According to a memorandum of agreement between Public Health and Health Services of the Pacific, they were brought in to provide clinical surveillance of inbound travelers held under quarantine at GovGuam isolation sites. These include physicians, nurses, LPNs, and non-clinical support staff, to name a few. According to the MOA, they're being paid also for overtime and mileage reimbursement. While the MOA was signed by HSP, it wasn't signed by Public Health Director Linda N. Pinko DeNorsi. Although we don't know just yet how much all these emergency purchases will cost UNI, as the governor has said in the past, quote, "It is what it is."
The normal rules don't apply in these circumstances.
The question, however, does remain, will it stand up to GovGuam's requests for federal reimbursement? We should also note that almost all of the quarantine isolation facility agreements have expired or will expire in the next several days. KUAM has also learned that a new round of emergency purchases will be done for quarantine and isolation facilities, but this time with the assistance and guidance from Civil Defense and GSA to ensure proper protocols and procedures are met. Reporting for Guam's News Network, I'm Sabrina Salas. Matanani.
At 9 o'clock this morning, the governor's designees are expected to provide an informational briefing to senators via Zoom on the government of Guam's response to COVID-19. Public Auditor B.J. Cruz, in the meantime, will be conducting audits of COVID-19 pandemic procurement, Adelup CARES Act budget, and COVID pay. Cruz says his office is currently finalizing financial audits, but engagement letters seeking information and documents will go out to pertinent parties next week. He tells KUAM 3 audit teams have been established to review the emergency procurement of hotels as GovGuam quarantine facilities, proposed expenditure of CARES funds, and public employee pay issues relative to double pay versus COVID differential pay. The announcement of audits comes after former Governor Eddie Calvo called out Cruz and Attorney General Levin Camacho for their silence on controversial issues surrounding the Leon Guerrero Tenorio administration's handling of COVID emergency purchases, procurement, and other issues that have made headlines recently. He adds that COVID-related audits were requested by several senators and news media. In the CNMI, Governor Ralph Torres, a Commonwealth Healthcare Corporation Chief Executive Officer Esther Muña, and the governor's COVID-19 Task Force Chairman Warren Villagomez unveiled the CNMI Community-Focused Economic Recovery Plan. This new policy outlines a phased approach to reopening economic activities in the CNMI, developing guidance to protect businesses and customers, and ensuring compliance with public health directives intended to safeguard all residents in the Marianas. One highlight of the plan includes the proposed resumption of tourism on July 15th. In national news, House Democrats unveiled a new coronavirus relief bill. The previous plans all passed with bipartisan support, but this bill was crafted without Republican input, and GOP leaders are saying it has no chance to pass the Senate as is. Natalie Brandt has more details from the White House.
The House could vote as soon as Friday on its latest coronavirus relief bill. The $3 trillion package includes up to $1 trillion for state and local governments, $200 billion in hazard pay for essential workers, and a second round of $1,200 stimulus payments for individuals up to $6,000 per household.
There are those who said, let's just pause. But the families who are suffering know that hunger doesn't take a pause, the rent doesn't take a pause, the bills don't take a pause, the hardship of losing a job or tragically losing a loved one doesn't take a pause.
But Republicans have already declared the Democratic proposal dead on arrival in the Senate.
We're going to insist on doing narrowly targeted legislation, if and when we do legislate again, and we may well, that addresses the problems.
The White House Coronavirus Task Force is scheduled to meet this afternoon. Dr. Anthony Fauci and the head of CDC say they will now resume attending White House meetings in person as long as they remain asymptomatic, wear face masks, and practice social distancing. The health experts testified remotely before the Senate yesterday about potential consequences for states reopening without meeting CDC guidelines.
There is a real risk that you will trigger an outbreak you may not be able to control.
My message later today will be that we really need to build contact tracing around the country. That's going to be our key capacity for the next 6 months to a year.
Dr. Tom Inglesby from Johns Hopkins University is one of several health experts testifying this afternoon as part of the first hearing from the House's newly formed Coronavirus Oversight Subcommittee. Natalie Brand, CBS News, the White House.
In your Banking 671 report, according to a new article, Reimagining Banking During and After COVID-19 by Jim Maris, the banking industry was much stronger before COVID-19 than before the financial crisis of 2008. However, the need for different strategies around marketing, innovation, and digital banking was clear well before the pandemic hit. The question becomes whether financial institutions will remain committed to new banking models post-crisis. Before COVID-19, the banking industry was experiencing an unprecedented period of growth and prosperity. Despite increasing consumer expectations and increased competition from non-traditional financial institutions, most banks and credit unions were stronger than at any period since the financial crisis of 2008. In a matter of only a few weeks, the world of banking has experienced a level of disruption that will change everything that had been the norm in financial services. Banks and credit unions must use this time of disruption to consider reinventing themselves from the inside out. It is a time when we need to better understand the way consumers expect their financial institution to support their financial needs. For more on this topic and others, go to the financialbrand.com. And that is your Banking 671 report. We're sponsored by Coast 360 and the Bank of Guam.
All right, thank you very much. Sabrina Salas-Matanani at 6:31, jam-packed show. We're coming up with Department of Corrections Major Anton Ogden for our weekly check-in behind the bars. We should call that. What?
Behind the bars report.
It's containing COVID. 6:32. The Guam Power Authority, Guam Waterworks Authority, opening doors today. So we wanted to get Simon Sanchez from the CCU on to kind of talk about that. Good morning, Simon.
Hi, Simon.
Good morning, Chris. Good morning, Bree. Great job.
Thank you. So big day for you guys. Do you want to just run us through what's happening with the utilities today?
Yeah, today both Guam Power Authority and Guam Waterworks Authority is fully open to the public. The FDN, the main FDN headquarters up in Mangilao, the payment centers in Hulali and Upper Tumon, as you rightly joked, I mean, just in time for all the payments being received by people between PPPs and the stimulus checks. People have been, to me, surprisingly good about trying to pay their power bills. We noticed management reported at the last minute there was an uptick in, you have payment agreements. In the past, you've fallen behind and you work out a payment agreement. And for the first time in years, we saw an increase in the number of payment agreements that were being broken because people didn't have the ability to pay. And, people are getting some relief now. And we didn't time it that way. We're hoping those relief checks would get out there sooner. And actually, we were talking about opening Monday, but now with social distancing and the new rules of engagement, for example, we're open to the public. So you can come pay your bills. You can get your engineering requirements and if you're trying to hook up a new account, all those services are now available at all the main centers. And the difference was we were closed to the public through this whole period until today. But you'll see some change in the infrastructure when you go to these places. Now at Hulali, for example, we've worked out a deal with A&Z to use their drive-through to accept utility payments for power and water. Wow. And at Fidian, we've created a drive-through for people to make it easier for them to pay their bills so they don't have to go in the building. But, there's people that need to hook up their new accounts. There's people designing new buildings, and they need to get stamps of approvals and reviews. And all of that is now open to the public, so that part of the process is also available. And we hope people, as they get their monies, that they, reserve as much as they can to try to, stay current with your power bill. And if you can start to catch up on your unpaid bills. But, we meet next week for a work session and then the following week for the formal session. But I'm sure we're going to have to think about how do we work with people who just were unable to pay their bills for the last 60, 90 days. And it's not even though checks are out, I mean, the economy's not back. People aren't getting full hours. There's great uncertainty. What happens when all this federal money stops coming in? Even though, it's encouraging to hear they're thinking of another relief package, but you got the House Democrats proposing a huge proposal, and you got the Senate Republicans saying too much, and we'll believe it when we see it. But for now, with what you're getting, you can make your payments at GPA or GWA. We're fully open. If you need to get stuff approved or reviewed, come see us, and we'll try to get life back to normal in terms of the utilities, and then we're going to figure out a way. I haven't talked to my colleagues, but my sense of it is in working with them is, we've got to give people enough time to get back on their feet. There's no interest. It's sort of like the landlord-tenant thing, where what good does it do for us to turn off someone who because of this virus had trouble paying their bill? Right. They don't have power. We don't have a customer. I mean, who wins? I mean, that's a lose-lose proposition.
So is that an official statement on disconnections? Because I know you said you're doing new connections now. So on the flip side of that, I wanted to ask, what are we going to do with disconnections? And then with the payment plan, you're right. There are people out there, a lot of people who just haven't been able to pay anything for the duration of the COVID crisis. So for those people who are listening to this and hearing that, oh, now you're open, how do they get in touch with the customer reps at the utilities and arrange that payment plan? And logistically, how does that work, paying down the bills from the last couple months or whatever versus the current bills that are coming out?
Yeah, so let's take it in pieces. First off, we haven't made a decision because the board hasn't met, right? I mean, on this topic, we have not made a decision. This is the first time. The governor has extended the emergency till the end of May, and we have matched that in terms of no disconnection. Right now, we're getting into a grayer area as we start to, come out from it. What is management's plan? And next week, that's the meeting. Is okay, management. What is your plan? And the board has to approve it. My personal belief, and I can't speak for all 5 members. We have to meet, right? But my personal belief, if the governor's extended it to the end of the month, and I'm comfortable personally with saying, hey, let's do the no disconnect to the end of the month. But then what happens on June 1st? Because I think the executive order goes till May 28th or something like that. What happens the day after the executive order stops? Or what happens if the governor extends it for another 30 days, 60 days, 90 days? We have to plan for both possibilities. And then, the way I look at it is the whole world owes the whole world money. Mm-hmm. And the ratepayers of Guam, the ratepayers of Guam owe the ratepayers of Guam for unpaid utility bills, right? Because we own power and water. All the money in those two utilities came from all of us, right? And it didn't come from the general fund. It's all been built up by the ratepayers putting money into those utilities and us managing it and producing power, water, and wastewater services. So we owe each other money. And so my view is, hey, if I have to bet on any people, I'm going to bet on the people of Guam. So that means that if we're going to have to be very creative and generous with the payback, let's say you owe 2-3 months of power. The current payment plan, I think, is you got to pay back in 3 or 6 months. That's going to be very difficult. So that tells me we should amend that current payment plan and come up with something that gives more people more time to recover in this time of still great uncertainty. And that's what we'll talk about. And I'm sure John Beneventi and Miguel Berdeo, that's what they're thinking and worried about. So what is our new plan? The current 6 month, that's it. It probably is going to be very difficult to enforce on people unless you want to start disconnecting a lot of people. And they don't want to do that. So that's the conversation. Management will bring it to us next week, and then we meet the following week, and we'll take a look at it, and we'll make some decisions. What do we do now that it's been extended? Once we know that there's no more emergency, at least officially declared by the government, governor, what do we do with the unpaid bills? And my approach is to take a very long view. If Sabrina and Chris owe Simon money, but I know Sabrina and Chris are going to be around for a long, long time, God willing, then what's the point of telling Sabrina and Chris, hey, you got a week, you got 3 months, you got 2 months when you owe me 3 months? It's just, what good is a plan that isn't going to work? It's not going to produce the payments you want. It's going to create great unrest at a time where people don't need this stress. Mm-hmm. And if we've got to be patient, if we've got to cut some of our spending, we have capital improvement projects that we fund from ratepayer money that we don't have to run to the bank to. So maybe we delay those projects for 6 months, a year, as people can refill their wallets and take care of their families. And we're clearly one of those people. I'm very impressed with how many people still tried to pay their bill even during these difficult times. We still collected.
Do you guys have a number of how many Sabrina and Chris's haven't been able to pay their power and water bills?
The only numbers I saw last month was we track how many people have payment agreements, and for the first time in years there was a spike in broken payment agreements. Where you had a trouble before you came in and said, hey, I had trouble here's what I can do, and then you miss a payment, right? That was a spike. We didn't get a count on how many people didn't pay their bills. We didn't collect as much money as we usually do, but it wasn't down 90%. It was still a pretty 70-80% of what we normally collect. So many people were able to make some payments. We're just going to have to work on that. Simon, Sabrina, Chris batch that said, hey, I couldn't make any payments, or I could only pay 25% of my bill. And we'll get those numbers. I mean, that's the kinds of questions that we'll be asking next week. Okay, so what are we talking about? How many delinquencies do we have? How many people would qualify, would have to get on a payment plan now that they've missed? What is that number? And then what is our process for handling it? And I think the most important question is, do we change the 6-month payback? Do we make it 9 months, 12 months, 18 months? I mean, that's a conversation we all have to have, because sooner or later we need to collect it. But, people are having very difficult times. They only have so much money. The economy's still not back at work. We got, commercial accounts that aren't in business, right? So we're all going to have to take care of each other that way, collectively. It's a collective debt we owe to ourselves. But that also gives me my perspective is, okay, since we owe it to ourselves and we're generally good people, then let's work with ourselves and give ourselves time. And Power Authority's not going away, Waterworks not going away, the people at Guam aren't going away. So we got to extend some debt a little bit. Yeah, it's that's what we do, and that's what we have to do. Banks are going to have to think about it. Landlords have to think about it. Power companies, anyone that is owed money for a good or service on a monthly payment where people weren't able to be employed. I mean, we're all going to have to think about it. I mean, some people are going to be, I use the phrase jerks, by saying, oh no, you owe me, that's it. But whether you have an empty building or an unpaid power bill, what good does that do you in the long run? You need that tenant. You need those folks to pay us. And if we got to give Sabrina 18 months to make up 3 months because it's more affordable, but we get the money back, can we look at that? Do we charge interest? If so, at what rate? But our interest rates are so low now. I mean, do we just say, nah, whatever you owe us is what you owe us? We, the people of Guam that own the utility, will give the people of Guam that owe the utility a break and time to make good.
What about
we can't cancel it forever, but we can definitely work on prudent repayment plans.
What about the government of Guam? Have they been paying their power bills?
As far as we can tell, they have been, and the power bill's much lower. So we're seeing sales about 10% lower. So there's less power being consumed overall, but that's primarily the business community, and the residential bill has gone up because everybody's staying home, right? But we haven't seen a big problem with the government paying the power bill. We hope with some of their CARES financing, that we're on that list. But we also have to remember, we can't all just say, okay, all 40,000 ratepayers, just don't pay your power bill.
Let's go.
Commercial accounts? Are there issues with commercial accounts? Are you seeing a spike in them not paying? Because a lot of them haven't been.
Last month was the last time we met Bree, and so it'd be kind of early to tell how bad has this virus affected our payments. But this month, I'm sure we'll get a huge update. We know we are collecting less revenue, so that's telling me 20%, 25% of our people, our customers, are not able to pay us or pay us in full. We collected less money in April than we normally do, and in March. So I'm with you, Bria. My guess is more people have had trouble paying their bill in whole or in part. So the list of people that are having challenges is going to go up. That's not going to be surprising news. Exactly how many we can share with you next week when John and Miguel brief us. But our expectation is the number of people unable to who were not able to pay their bill for the last 90 days has gone up. And so how do we wisely and work with that situation and give our people a chance to recover?
All right, so we just wanted to get you on. I know are you going to go and tour the sites this morning or anything?
I might run up there. Unfortunately, my laundry is closed today because we don't have any customers, so it's a good day to run up and do that. But we've got a great team that manages it. The commissioners are paid $500 a month from both utilities, but we pay people a lot of money to worry about all of this stuff. So we might let them do that. And the other thing that's changed, and I know this has been a topic of conversation, we paid the double pay based on our interpretation of the rules and regs, as long as there was an emergency, and we did that. And we had a slightly different interpretation. We felt we weren't open to the public, even though work was being done. People were running generators, people were fixing leaks, customer service people were receiving payments and processing, accounting was doing the financials. So people were working from home, But if you had to come in, we paid the double pay. If you're working from home, you just got the regular pay. But the double pay ends today because our interpretation was the facilities are now open to the public, and since they're open to the public, then the double pay that will stop. And I think the thing that we've done is that we're letting all our employees know today, right? That hey, we're all back to work, even though many people still work at home because of the social distancing. We haven't quite rebuilt the infrastructure, the spacing within the office space. So some people will stay home, but Mike, Miguel, and John B. and the crew, they're good. They're engineers. They think about this stuff. So their plan is we're ready for the public, all full services at our normal locations. We got some drive-throughs. If you come in, double pay ends today for those that were qualified. Everybody's back to there'll be some differential, though, according to John B. and Miguel. The customer service people that will be exposed to the public that come in to pay, they're going to get that hazard pay. There's a difference in the rate between the old DOA rule and the governor's executive order. And, we wrote a letter to the Attorney General, but we just haven't heard back, which number applies. So I'm not quite sure which one we're applying. It's not a big difference, but the governor's differential rate was slightly different than the DOA one.
When did you guys write the AG?
A month ago or so, something like that. And I'm getting the secondhand only that management told us that they had asked for an opinion from the AG, but we've gotten no response. But it's been at least a month because it was in last month's meeting where it was, because we all asked. So what did the AG? Did anyone? I mean, we have our own attorneys, and we're forced to opine. And unfortunately, you got the old DOA rules that's been in since before you two were born. And then you got the new executive order, and the rate of compensation is slightly different. So I think we paid it under the old DOA rules for now, and no one's made it clear. And ultimately, even if the AG opines, remember that he's at the end of the day, he's just another attorney. He's an important attorney, but until the court says pay it this way, pay it that way, you can waive this, you can't waive that. Until that's settled by a court, it's just guidance from an attorney, an important one. But being the senior attorney, we wrote him a letter. Management wrote him a letter, but unfortunately, he hasn't opined on that.
Right,
issue.
and we asked about that.
We had to opine it.
I think Senator St. Augustine also has asked for an opinion, and I think they're going to come out with one in the next few days. We tried to get the Attorney General on, but the response we got was that there's nothing really to talk about. Yeah, because they're working on the opinion.
I saw that. So. I mean, the guidance will be nice, but again, even then, someone can challenge it.
There's other things to talk about with the Attorney General.
Yeah. So I'm sure
we'll get to those. Thanks, I appreciate it.
A lot to talk about.
Yeah.
Yes, very good. But thank you, customers, ratepayers, and co-owners of our utilities. Thank you for all you've done. We'll be patient with you as you've been patient with us. We're open for business. If you want to start talking about a repayment plan, please, you can start that process. If you want to pay online, all of those things are still available. I called in and paid both my power bills yesterday.
We had a comment here, Simon. Can Simon please rub his common sense off to those leaders that desperately need it?
Well, we're doing what we think is right, and we hope others are doing the same and thinking it through. I mean, this is unprecedented. Heck, but we now have a new morning show that we didn't have 3 months ago, and it's a great show, right? But sometimes
rapidly evolving.
The Facebook feed drops off, right, and all that stuff. And Chris had to give me the phone number. I didn't know what the number was. So I wasn't prepared, right?
We're standing it up as we go.
Yeah, but I mean, these are very tough decisions. I mean, we could be wrong on ending the double pay today for our employees, but this is what our attorneys have advised, and we could have been wrong on which rate to pay. But at least the stuff we do control, the payment plans. My sense of my colleagues, we all love Guam. We've all been here. We're all longtime residents. To simply say, nah, it's 6 months, we're not changing the rules. I said, I'm not going to support that. We've got to be patient with each other. It's a difficult time for everybody, and all the relief money is going to go quick. It's already spent, right? They just need the check just for the cash to follow it, so they can pay their rent, catch up on their power, take care of their kids. All of that stuff is we all have to be patient with. So even our customers should be patient as we try to do things with common sense at the utilities and hopefully in the rest of the community. So, but we'll be listening, and thanks for giving us a chance to talk to your listeners and get the word out and hang in there, Guam. We love this place. We're not going anywhere, and we're going to work through this since we're not going anywhere.
Right. Okay, so thank you. Appreciate it.
Thanks, Simon.
Okay.
Okay, take care.
Yeah.
Be safe.
Wash your hands.
Also,
Hey.
big thanks to GPA and GWA employees. I just had to say that.
Right, getting that double pay. They're making
And
all
just
the
working,
right,
you know, keeping us going
keeping the lights on.
and the water running.
Yeah, amen. 6:50. Let's go over to Mahilo, to the Department of Corrections, and go behind the bars with Major Anton Ogden. Good morning, Major.
Good morning. Good morning.
Good morning.
I guess we'll just start with an update on the incoming. I heard that there were some developments with the incoming. Now, I don't know if you could just set us straight on this, but what we're hearing is that there was a memo that came out that you guys were going to do the incoming through the postal, and we're hearing that the memo was signed off on by 3 of the senior DOC leadership, but then that memo was rescinded the next day by the director.
Wait, take me back. What's going on?
Yeah, go ahead. You just handle it, Major. What's the deal with the incoming and the idea that people were going to mail it in and now they're not?
Well, yes, a few weeks ago, the idea was to allow incoming through parcel package. See, under our rules, inmates can receive parcel packages through the mail. And so originally that's what some were doing. Some family members actually were already sending it in. And they were going to allow more inmates to do that. But, you know, after rethinking the whole process and re-examining what it would take to manage an operation of parcel packages coming in, plus the cost of the family, because parcel packages can be pretty expensive.
Wow.
The director decided, you know, let's hold off on that. And we're going to start the incoming on the 25th. So next week there'll be some incoming. There's a schedule out. It's been given to all the housing units, and we're going to do 1 unit a day. And there's different times: 8:30, I think, to 11:30, and then 1:30 or something like that. Maybe exact wrong on the hours, but until like 3:30 in the afternoon. The family will be able it's broken up per housing unit because we have 18 different housing units.
Right.
And it'll go all the way into about June 5th, I think, when all the units would be accommodated. And it would be a drive-through. The families we're going to have officers out there controlling traffic, and the families will be allowed to come up, stay in their vehicle. They'll be wearing masks. They'll be having their temperature taken before they even drive through our gates. And they will hand the incoming items, which is only personal hygiene. There's a list of authorized items.
Yeah, and Major, can we just go back, because I was using my insider term, incoming, and I don't know if people out there know what we're talking about. If you could just, layman terms, describe what do we mean when we're talking about incoming?
Well, Chris, DOC does not have a prison commissary, so inmates cannot purchase personal hygiene products or other items that most prisons in the mainland they have, where inmates can purchase those sort of things. So we have a process called incoming. There's a list of items that the families are allowed to bring in on a schedule. Usually it's a monthly schedule. And since the COVID, we had suspended all those activities. So now that we're in PCOR 2 and we're moving towards PCOR 3, we are going to open up the incoming, but only for personal hygiene. So, like toothpaste, and we do provide these things.
But it's the government. It's the government toothpaste, right?
Yeah, we do provide.
It's like the powdered eggs of toothpaste.
And the government soap and stuff like that. It's
the government soap is not pow pow.
Yeah, it's not the best. So some families want to purchase it for their loved ones while in prison, and so we are, have that type of process. And so come the 25th, families will be allowed to, again, bring in personal hygiene, razors, soap, shampoo,
Man, Major,
sanitizer.
That's 11 days away, though. What are we going to do in the meantime? And then going back to the...
Why did it stop? Did you say?
Because they decided that... So let me just get this straight, Major. Someone at DOC said, yeah, we're going to let you guys mail in the incoming supplies for inmates or whatever. And then the director said, oh, that's probably not a good idea. But what I heard was that the people had already sent packages over for their family members behind bars, and now they're saying that they're not getting those packages out. So what's the status on that? And then why do we got to wait 11 days? I mean, these inmates haven't had any incoming for the duration of the COVID crisis?
Well, today is already Thursday, and so it's going to start Monday, the 25th.
Anton, today's the 14th.
I'm sorry, 14th. I'm sorry, the 25th. Yes. Well, they're still working on some details. That was the date that the warden and them came up with, management, and the memo went out because we have to give time to the family members to prepare and purchase whatever they need to purchase to bring in the items. The last thing we want is someone complaining, you didn't give us enough time to get what we needed. We weren't prepared. Can I bring it in this day instead of this day? And other things like that. So we need to let the inmates know, give them ample time to inform all their family members so their family can get whatever they need to get that is authorized. So when that day does come, the process is a lot quicker, and we don't have to stand there and discuss with the family what's authorized and what's not authorized.
Right. So how did you guys come out with a memo that says, yeah, mail it in, and then the very next day, did the director not know, or?
No, I mean, again, I don't know what the director was aware of or not aware of, but I do know, throughout the day, certain management people do talk to the director. I mean, I'm not in all the meetings when the director is speaking to the different employees. And originally it was thought of that way, but when we sat down and we said, okay, we're going to allow these packages to come in, if we have 650 prisoners. So our process with packages right now is that when the package comes in, we have to take that package, open it up in front of the inmate to verify what's being sent, and items that are not authorized are then confiscated, and then we would normally send it back out with the family when they come in the following week or next couple weeks later to pick up, to drop off incoming. We would give it back to the family and say, hey, these items were not authorized. And we figured, if we, as we drew out the plan, and we said, okay, if even 350 people send in a partial package, that will be a logistic nightmare as far as going through every single box with every single inmate, ensuring that whatever came in the mail is in fact authorized.
So do you have some packages that came in when the families thought that they were supposed to, right? So what's the status on that?
So what's going to happen, Chris, is that those particular packages will eventually be given to the inmate. When they come in, we're not going to deny the package. I mean, the process already happened. It was sent in. And so we're going to go ahead and deliver that to the inmate. Now, what will happen, though, and that's why we need time to go through who has a package, who doesn't have a package, is that, so let's say an inmate received a package through the mail of personal hygiene. Well, that family, that particular inmate, he will not be allowed to have a family member come and drop additional supplies because you've already received your allotment through the mail. So, because sometimes the inmates, they would do that. They would mail some things in, and then they would try to drop off additional things, and that's not the way it works. You only get one opportunity to drop in incoming. So those that mailed it in, they don't have to worry about coming in and physically dropping it off because it would have already been received by the inmate. So those packages, again, will be given to the inmate. We're not sending them back.
Okay, so when you start the incoming on May 25th, Major, is it going to be the regular process where they actually get down, or because I remember last time we spoke, you were talking about drive-through.
Yeah, it's going to be a drive-through process in Manila. Even those for Ganya will be received up at Manila, and again, the vehicles will be coming in. We'll have officers out there that will meet with the visitor and get the authorized items from the visitor. The visitor will not get down from the vehicle. They will be required to wear masks, and we will get the items, put it on another table, wipe them all down, sanitize them, put them in the vehicle, and later that after it's inventoried and everything's been squared away, later that evening they will be delivered to the units.
Right. Major, what can you tell us, because we had a tip that, was there another contraband bust maybe last week, and were there more inmates or detainees who were tested? We're tracking that there was an incident, and of course we want to vet it and verify it with you, but just what we hear from sources, that there was an incident and something about inmates and detainees refusing to be drug tested.
Well, we did do some drug testing a few weeks ago.
Right.
Yeah, and so when we do the drug test, yes, the inmates, they still have a right to refuse to take a drug test. We can't force them physically to take a drug test. And so we did test some housing units in response to contraband that was found, and some of the inmates did refuse.
Is this a separate incident from what we had spoke about last week, where you guys had tried to test one of the COs and they refused to be tested, and then did they quit? So is this another incident, Major? Because that's what we were told.
Yes.
So when was this?
This was a
separate
housing unit.
Okay, go ahead.
Maybe a week or so ago.
Can you just give us the 411 on that?
Again, we just ordered the director and deputy director ordered a drug test on one of the housing unit due to contraband being found outside the unit.
What kind of contraband?
It was like I think it was Copenhagen, some cigarettes, lighters, cell phones. It varies. I can't recall exactly, but again, we still have an issue of people throwing contraband over our perimeter fence. And so again, one of the deterrent, actions is to, if it's found by a unit, the director's, the deputy director and them's plan is to drug test those inmates in that housing unit, right, as a deterrent to, from them bringing in contraband. But
Did you say drugs were found?
Yeah, sometimes. Well, I can't recall what exactly we found. I don't have my notes in front of me, but yeah, sometimes we find drugs.
Yeah, but in the incident you were referring to, were drugs found? Because, drug testing was ordered.
Yes, I believe drugs was there.
What kind of drugs?
Usually it's ice. Yeah.
You don't recall how much ice?
No, it's not a lot. I don't know all of it. It's like a package, just a ball of package, and we turn all that over to GPD.
What housing unit?
This was up by the recreation area, by the basketball court, by Post 16.
I'm sorry, what's Post 16?
General population.
And then Major.
Inmate housing unit, yes.
Right. Major, so when these inmates and detainees refuse the drug test, are they supposed to go into disciplinary segregation? Are we able to still do that? I don't know. Is that the process?
Yes, generally that's the process. There's also another process where they could have their classification reviewed and possibly demoted from their classification level, whatever security level they're at. They can also be reviewed by the casework and be demoted.
Is Post 16 near the perimeter?
Yes, yes it is.
Okay.
So they threw over some of that COVID crystal.
Yeah, that's
what you believe, or has that been officially determined that it was thrown over the fence?
No, yes, it was thrown over the fence.
Okay. Major, and so when you said some inmates refused to take the drug test, does that mean others did? And then what could you tell us about the numbers, like the results, or how many inmates are we talking about here with this latest incident?
I don't have my numbers in front of me, but I know several of them did take the test. Several inmates did take the test. They passed the test. They were not positive. Others didn't take the test. And so there's a process to deal with that, and that is being handled right now at the warden's level.
Yeah, because the tip we got was that why aren't these guys in disciplinary segregation? But you explained the process, right? So they could get their whatever privileges stripped, or
yes, there's different processes. Especially Chris, when you have with our issues right now, the COVID, and then even with the disciplinary, you have our disciplinary DSEG unit can only hold 48 people. So again, there's two different processes the director can decide to take, and one is the classification side.
And then, Major, where are we with the, I don't know if you can speak on this, but the confirmation of Director Carbolito? What's the clock? Are you guys following the clock on that?
Sir, I don't have any information. Unfortunately, I'm not following that, so I don't have much information on that.
Yeah. The appointment papers were submitted to the legislature yesterday.
Oh, okay.
Yeah.
Well, I'm not following that one.
Okay.
Okay, anything else you want to add, Major? What would you say to those people out there who are now going to have to wait 11 days for the incoming?
We've already waited 69 days, 70 days for this, and I think we can wait another week or so until until we get this for the incoming.
You already waited forever. What's forever and a half, guys?
Yeah, what's another?
Come on.
About as long as the stimulus checks.
Yeah. Well, maybe that's the other thing too. Is some family members are gonna have to get some money.
Right. But you guys wanna do it for the inmates, right?
Yes, sir. Yes, sir. This is something the director's been again, but we have to weigh it with, we have to look at it with some caution.
Yeah.
Again, we're trying our best to ensure that the COVID-19 doesn't get into the prison.
Let's see the COVID.
You guys got any of the CARES Act funding yet?
Most of our funding that we're going to get, I think, is in we're not getting funding directly. The funding will go through, I believe it's BBMR, the other government.
Lordy, you better check. You better go station somebody at BBMR and make sure that money gets where it needs to go.
We're going to get supplies. We're getting supplies, and so I understand there's some supplies that have just come in, and we'll probably be picking it up later this week, today or tomorrow.
Right.
Oh.
Yeah, because we're getting mostly supplies.
Yeah, I wonder if they're going to give you any of those masks. They had a big donation yesterday at the office of the governor from Taiwan. They received, I don't know if you saw this, 200,000 surgical masks.
Yeah. That's probably what we need.
You need some masks, Major?
Yeah.
Okay, so we'll shout it out to the Adelup that if we could get some of these masks. I sent you that if you want to put it up. We'll talk about it later.
Yeah.
Okay.
I mean, we have masks already in DOC, but of course we could use more. And I know, like I said, our portion of this CARES Act is mostly going to be in hygiene products and PPEs.
Nice.
Personal protective equipment.
Right.
Yeah.
Okay, Major.
Okay.
Yeah, did you get your differential pay?
We did get 1 week.
How much?
1 week.
How much, Major? What are the guys saying? Because we're hearing nobody's happy with the differential pay.
Well, I mean, it's something more than we didn't have a couple weeks ago. I know some were anticipating the double pay, but for now, we just have to accept the 25% extra for now, and hopefully this double pay issue will be addressed and worked out later.
You guys are under GFT, right? So do you know if some of the officers are signing up with that lawsuit?
I know some officers have inquired about it, and I know some officers probably have already signed the documents to participate in the lawsuit. We do have officers that are GFT members.
Right, right.
Well, you don't actually have to be, according to Robert Koss.
Yeah.
No, you don't. You don't. Yeah.
Okay.
Okay.
Right on, Major.
Antone.
Thanks for waking up early with us.
No problem. No problem.
Okay. Take care.
Okay. We'll see you. We'll see you next week. Be safe. Wash your hands.
Okay.
Okay. Stop.
All right, bye.
All right. There you go, Major Antone again. Hey, that guy will stand in and he'll answer the questions.
Yeah.
707.
Always transparent.
Yeah, he is very transparent. Let's go to the phones where we have from the Governor's Physicians Advisory Group, Dr. Hoa Wen. Good morning, Doc.
Hey, good morning.
Hi.
Good morning, Sabrina.
We're going to talk about that contract in a sec, but I wanted to just get you an update. We know that there was the Physicians Advisory Council for the Governor. There's a meeting Tuesday night.
Mm-hmm.
Right? Can you just give us an update on what was discussed in the meeting, Doc?
The major discussion of the meeting is we forward the proposal for the governor to review already yesterday, and I have a lot of email from people either off island or on island from Guam resident that request to see if we can push the for the return residents of Guam to be quarantined at home, which make a lot of sense. Since everywhere else that's what they do. They don't quarantine our people in the hotel, and I think that we did this long enough already, and that so the proposal has been going up to the governor, and I said that's the main thing. The whole 2.5 hour discussion is that to get our people back home when they travel from off island. So the key here is quarantine at home and require them to do the PCR testing after a certain period of time to quarantine at home. And then if they PCR negative, then they can be clear with the condition that within that 14 days that if they have any symptom, that they have to report to the clinic to be evaluated. But so that way it saves the costs for the people on paying for hotel. The only one that require to stay in the hotel for quarantine, if you have people off island that's non-Guam resident that come in and to do whatever business or what they do in Guam. But if they have a PCR testing 72 hours before they arrive to Guam, then they can be cleared through the quarantine, but they still have to be watched in 14 days. So the whole process will change, and that's from the U.S. And for the Saipan, we also suggest the same thing for Saipan. But Saipan is kind of unique because all their cases come from Guam, so they really protect community in small islands. So they're actually pretty safe. So for them to come to us, we recommend that we don't have to test them just because they have a very low rate of infection over there. Like I say, all the infection is really come from Guam to travel over there. So there's a lot of change, but the main thing is get our Guam resident off the hotel quarantine to home quarantine.
So what was the response?
She have a lot. We have a proposal, but I'm sure there's a lot of things that she had to talk to her legal staff and everyone up there. But it's like I say, pretty straightforward and very simple. Like I say, it's done by. We have a lot of physicians on the advisory board, so I think. We wait. We have another meeting tonight, and we'll ask for update to see where the proposal is. But I have quite a few letters since I guess last time I talked to you guys. I guess people listen to it, and they really want to push this issue on home quarantine for return residents.
Right, and just going over the contracts for these quarantine isolation facilities, actually, some of them expire in the next couple of days, and there is that option to renew for a month.
Yeah, I know a lot of people are still in there. I don't know how what the right number is, but depending on how many days in there already, we can go back and test them and still send them home for home quarantine rather than keep them there for 14 days. Right.
We heard that the ISO days in Wyndham is pretty much empty.
Yeah, the ISO is pretty much empty. As you can see, our case is actually 0 or 1 for many days now. I think the whole island of Guam, we did a beautiful job and kind of start this virus, like Dr. Shea saying. And it's basically we are doing very well. I don't see that many really sick patients in the clinic, so it's like a pulse to see how the island does at this point. But we are actually doing very good, and if by the end of next week, if we like this, we are in very good shape.
Okay, Doc, let's get into this because we had you on to clarify that there were several clinics that were listed in the CARES Act budget proposal, and there was $7 million that they had proposed to set aside for the payment of Tier 2 clinics that assisted with the COVID-19 response. But when we brought you on, I believe it was last week, you said that you guys don't have a contract. That was a proposal. You're still trying to figure out whether or not you're even going to get reimbursed. Is that still accurate, Doc?
It's still accurate, guys. I mean, none of the Tier 2 clinic or Tier 1 clinics have any contract at this point. It's we put a proposal there, and I think it's supposed to be reviewed by the AG office, but so far we have not received anything or any contract or firm MOU or MOA, anything like that at all, at any clinic.
Right, and so what I had sent you yesterday was one of these memos to BBMR and DOE for so ordered payment. One of the memos includes a contract for health and wellness services or health services of the Pacific, and we're going to show what we can. And Bree covered this in her story, but I had sent it to you because I just kind of wanted you to look it over, and I know you had eyes on it for most of the day yesterday, so I guess the first question is, why do you think you guys are sitting around twiddling your thumbs with nothing on paper? But on the flip side, we have a company that already has a done deal. I mean, do you have a seat at the table? I guess you just first answer that. Why do you guys have nothing, but we have a full executed contract that's going to be paid for another healthcare entity?
So Christian, when I looked at that thing yesterday, mainly not to ask the question why we have not and why someone has.
Okay, so never mind that.
Above my pay grade, but
okay.
The only thing that I would say is that if I read the contract yesterday and just comment on whoever writes the contract needs to kind of know who's is qualified to do the triage and screening of this passenger and the treatment of the passenger, because this is really a gatekeeper for Guam, as these people need to be well trained to do that. But I do not think professional-wise that physical therapists, occupational therapists and occupational therapist aide and nurse aide, they're not really qualified to do this thing. It's some part that it's a registered nurse, the licensed nurse, and I'm not quite sure why the medical assistant, profession is not involved. That's probably the most efficient way to do business on this contract, is use medical assistant. Those are wonderful trained personnel that can use that. They're not as expensive as the physical therapists and the occupational therapists, and all those are expensive assets, and again, those assets is not trained to do what the contract wanted to do.
Have you sent an invoice? Because the way it seems is that all you got to do is send an invoice in, so that you could get paid, or AMC or any of the tier 2 clinics.
Yeah, it's what the people and don't understand when they do the contract with any kind of medical service. Number one is qualification of people. Number two is it's not an invoicing. Basically any tier 2 clinic will have to curve a lot of their line of service in order to service the COVID patient at the location. Right. Because most people, I have patients crying they don't want to come to a clinic because it's a COVID center. Right. So you have to curve IV infusion service. You have to curve well child check. You have to curve the annual well check. All that stuff has to be put away in order to open your center out and put all the steps in there to protect the patient and to protect the staff from getting sick. Right. So it's not an invoicing from Sabrina. It's really a whole line service that you cancel. So
we get it. I mean, Doc, basically you guys were deputized by the administration, and you were brought into the COVID-19 fold. However, the surge that we all anticipated never happened. So I feel like on you guys' end, you probably lost a lot of money. And I don't know, how do you start that conversation for the compensation of your services? I think tier 2 clinics they lost a lot of money, and I know we are pretty fortunate to keep our staff on to serve people in Guam. But I know STA and FHP, I can't speak for them, but I know that they either had to modify their staff and probably let go some of the staff, what I heard, just to stay afloat, to go through this tier 2 requirement.
Mm-hmm. Can't tier 2 clinics be paid through HHS funding?
I'm not quite sure. We approach in many different ways, either through the Medicaid program to see if we can accommodate for that, and explore different sources, but so far nothing there. And again, I'm not quite sure. We put our proposal there, tell them what we do, but we have not heard anything back yet since a week ago.
Is this from
again? We continue to do what we do. We still continue to serve people in Guam. Pay or not pay. we're still going to do what we do. We're not going to change, and even if we have the second wave, we will continue to do the same thing.
Let's go back to this HSP. So you're basically, what's your take on this contract, Doc? So you're saying that we're going to be paying people who aren't qualified to do the jobs that the contract says they're going to do?
Yeah, it's a big task. That's it's a lot of requirements. It's a manpower driven, and I think if anything else, it would require multiple clinics to do this thing. Because it's one single clinic, even for AMC, we wouldn't handle that one. It's a lot of manpower, So it had to be careful who you put in there for clinician-wise, and because, like I say, this is a gatekeeper for people who do the screening and the diagnosis and maybe the treatment for the passenger. You got to know what you're looking for, and you got to put the right qualified people to be on it. But like I say, some of the clinicians there, more than 2/3, I don't think they are trained to do that.
All right. So are you going to bring these concerns up in the physician's advisory meeting? Maybe print out a copy of it and storm into the meeting. Like, what is this?
Yeah, we're going to bring up to the PAC and ask for all the comments from the board member. Like I say, is what we worry about is, like I say, is the safety of our island and how they do the screening there. Now, we all heard that there's a lot of not well planned, screening process there. So I wonder, just because the experience or what, but it's not a group of healthcare provider that have to be there. It's got to be changed and mixed somehow.
Doctor, well, last time we spoke, you said that you hadn't been paid a penny by the government of Guam. Is that still accurate?
That's still accurate. We pay zero. Any Sunshine Act can look at that and see. We actually, any Tier 2 or Tier 1 clinic are not reimbursed anything at this point.
Are you guys still being used as Tier 2 clinics?
We still serve as Tier 2 clinics. It's a lot of, I know AMC SDA and AMC and few of the Tier 1s still, have a lot of referral from other physicians and other people that show up to see when they're sick. The coronavirus is really strange. They have all type of symptoms. So anyone walk in the front door complain of abdominal pain or diarrhea, any type of symptoms, you gotta treat them like they have it. So you have to take the necessary precaution to put in a special room in order to not contaminate the clinic or, get your staff sick. So yeah, all precautions still there.
So how long are you guys, or you and the other medical clinics, supposed to be a Tier 2 clinic? And there's nothing in writing? Until there's a vaccine, or?
Yeah, no, like I tell my patient, until we get the treatment in place, just like if you have influenza, you have Tamiflu to work for, and it worked wonderful for that infection, or we have a vaccination, we're going to be in a new norm of have to be cautious on any symptom that you get sick, because like I say, right now, we do not know enough about this virus, and every day we learn new things. So you have to be extra precaution out there in order to not get infected or spread the infection to someone else. This is so strange. Some people come in and we test them, and we actually say, nah, it's not going to be positive, and they turn out positive for very mild symptoms.
Right, but we've been seeing a consistent number of zero positives. I mean, are we still in a healthcare emergency?
I think until you have to, in order to not go backward. If we open our business slowly in step like she does, the governor does, you'll be able to control it better. And if the only thing you don't want to happen is that we open really fast, and the second wave come, and you have to shut everything back to square one again. And that's not what people want. We want to open our business. We want people to go back to somewhat the new norm in life, but you have to be very cautious and make sure that we have a very unique case on the island, any island, is that we can control this thing. So we have to approach it very slowly. And, every day is different, Sabrina, Chris, and, maybe by the end of June, that if we have 0 case still, 1 case, and things are open up well, then you can reevaluate and say, hey, are we still pandemic emergency or not? We can say it that way. But right now,
I'm asking that because if we're talking about recovery and we are slowly reopening the business, we need to talk about how is our tourism industry going to recover. Who's going to want to come to Guam if there's a health emergency here?
Yeah, so right now, the people look at, if I go somewhere, I would look to see if the case there is a lot or just few or just none. So people in the world know, we report this thing, so they know how many cases we have every day. So, if we continue to go where we are, Taiwan, Korea, and Japan, they will look at us, but that's the main source of our tourism. They will look at us and say, hey, maybe they're safe to go. Right now, when we look at our tourism, it's not us that don't open the door for people to come in. We really want to open, but the people our tourists that come to Guam, when they return to their country, that's where the sticky part is. Every one of those 3 countries still require 14 days quarantine. So they don't want to go back, if they're going to go to Guam for vacation. So it's not us, it's their country that put a restriction on our tourism. So that's what people so our business needs to be aware that the government, she really tried to open as soon as possible, but if our tourism that we depend on those countries don't relax their quarantine, we kind of sit and duck in the water.
Okay.
Okay.
Doc, thank you so much.
You're welcome, guys. But again, Chris, Sabrina, just pass on the word to the whole island that we do a very good job of containing this virus. So continue to wear your mask and wash your hands and be cautious in the public still.
And what about getting tested, Doc? Do we still want people to go get tested?
If you're symptomatic, you need to go get tested. And right now, our test kits are plenty. So you can go to the northern, the central, the southern public health, and any tier 2 clinic, and if you're with a tier 1, and if you have any symptoms, they can test you. It's not a limitation in the test at this point. So
we have a lot of tests.
Yes. So the mass testing, public health will do at some. It will kind of stop soon, but testing out there in the community. At the clinic level is still there. So we're not in shortage of testing at this point. So we're clear to go to PCOR 2.
I wish that they would, I don't know if they can use any of that CARES Act funding or if there's a budget for it, but I feel like there should be PSAs or a jingle or something like, go get tested for COVID. You know what I mean? Just to kind of raise awareness and tell people that, because I feel like we're kind of in the dark about, are we testing, are we not?
Yeah.
Yeah, for symptomatic
patients, like a marketing campaign, it's free.
Yeah, for symptomatic patients, it's totally free, guys. It's really free. I mean, the only one we really turn out a few is if a company require you to be tested before you return to work. For asymptomatic patients, and we still deny those. It doesn't make sense. Because if you are asymptomatic, you return to work, it doesn't make sense for you to be tested because you can pick up the virus the next day.
Right.
So it's really senseless. So that's only one that we say no.
So is there another phase of this testing? Because I know Dr. Cabrera, when they had the latest, his latest press conference where he spoke about this next phase, and we're going to go out into the community and we're going to do all of this. So I'm wondering, what's the next phase of this testing?
I think that phase has been done already.
What's the plan now?
The plan now is we open our business up slowly, and if you have symptoms, you come into any clinic that can do the swab and test you. And if you're positive, there's a very good tracking team, a tracing team that jump on top of it and basically isolate you and do the contact tracing right away.
I thought that was what we were doing now. I thought that was the phase we were in.
We are doing now, and that's the phase. And the next one, Supreme Court, is basically, if we continue to have zero, is to slowly go to PCOR 3 and open for the tourism. And again, the PCOR 3 is challenging, not by us, but by other countries around us.
Okay, Doc, appreciate it. We got to run.
Yeah, just one other thing about the tier 2 clinics, and then follow up to Speaker Tina Munoz Barnes. So what are you guys going to do? Are you guys going to ask the governor to send over the MOA or send over your invoices?
We asked for a subpoena, so we just sit and wait, but like I say, we continue to do what we do right now. And we just sit and wait. And do we have or not have it is really up to the AG office, actually, because the AG office has to make sure that that is legal and make sure
I disagree with you. Because these memorandum of agreements that are posted on the governor's website don't even have the AG signature. They don't even have the signature of the Guam Homeland Security.
What was the response, Bree? Because I know you had reached out to the AG's office yesterday and asked, "Hey, how come this stuff isn't signed?" I just stay as physician. I let our legal counseling do that from Sabrina Crystal. They do their work, and I just stay in the clinic and see patients.
Right, but was this ever negotiated? Like when you guys first went in, and when these clinics were asked to be these tier 2 clinics?
No. Well, I think at that time.
Who asked you guys?
At first we volunteer, and then the governor asked to see if we can be in the tier 2 clinic to serve community of Guam, and we say yes, we don't mind. So. She took over and create the declaration for the care team, and so we fall in the tier 2.
Okay, so at that point, when the declaration was made as tier 2, that's when the clock would start ticking in terms of payment or reimbursement.
During the declaration in there, it say that the reimbursement will happen at that time, but we have not approached that. We approach it, but it's a lot of not understanding what we do there on the side of the government. So we kind of on the dead stone still. I think we're moving to the second base, so we need to kind of move to the next base sooner or later.
Right. Yeah. I mean, it would just be more transparent if we knew just how much the people of Guam are going to be paying for these tier 2 clinics.
Yeah, that's a key. Like I said,
and there's no agreement in place. I mean,
there's no
mind-blowing here.
So there's no agreement in place, so it's really, it's kind of hard for me to tell you what we're expected to be paid, and there's actually no agreement in place, because I can tell you one thing, and then the AG office, the government changed our agreement, and that's what I tell you is not the right thing. So I'm sure that when the contract come out, the MOU come out, it's be just like exactly HSP. It be there, so be transparent for everyone to see what we pay for.
Okay.
Okay, Doc. Thank you.
Okay, guys.
Keep us posted, Kay.
All right.
We will. Be safe, guys.
Let us know when you get your big tier 2 paycheck and to buy some donuts or something.
Okay, I send some donuts to you.
Thanks,
All
Doc.
right.
Okay.
Bye-bye.
7:33, Guam's favorite containing COVID. Hey, we're going to take a break, come back with Kathy Castro from the Guam Chamber of Commerce. And we're talking about the AG. A lot of people are talking about the AG. Former Governor Calvo was talking about the AG. And so we had actually sent him, his office, inquiry, a couple questions about potential conflicts of interest, and asking him also to disclose some of the relationships that he has with the administration. So we're going to talk about that coming up here on Containing COVID. And also John Fernandez, Superintendent, Guam Department of Education, is on the way. Senator Sabina Perez, who is prepping for that oversight hearing. She is the Procurement and Rev and Tax Oversight of the Guam Legislature. That's all coming up here on Containing COVID. Good morning, Guam.
Keeping you informed, KUAM News brings you Banking 671, brought to you by the Bank of Guam, the People's Bank, and Coast 360 Federal Credit Union. Together, we thrive.
KUAM News COVID-19 Takeover on I-94 FM is presented locally by Ambrose Inc.
GU Self-Storage, conveniently located near the Harmon McDonald's. We offer affordable rates, online payments, and auto bill pay for your convenience. Plus gate access daily from 6 a.m. to 9 p.m. Call us today at 648-7867 for more information.
With the new challenges we're all facing, First Hawaiian Bank wants to make sure you have access to your financial world. With FHB Online and our mobile app, we hope to make banking the least of your worries. Visit fhb.com/digital.
Be healthy. Be informed with ITD. with IT&E. Be healthy. Be informed with IT&E.
Hey, good morning to our Facebook Live audience. I see you, Marilyn. Marilyn comments, "You're going to bring a wand before checking the mail today." Oh, stimulus check, here I come to get you. Abracadabra, agracamus, please give the people their stimulus. I'm going to get the wand in a little bit. 7:43, it's Containing COVID. Proudly brought to you by Cabo Enterprises, IT&E, Coast 360. Bank of Guam, and Ambrose Inc. At 7:43. We wanted to bring Kathy Castro from the Guam Chamber of Commerce on, as of course we saw some gradual reopening start on Mother's Day, and just kind of wanted to bring you on, Kathy, and find out how the chamber and your members are doing under PCOR 2. Good morning.
Hi. Good morning.
Good morning.
So what's the status?
For having us.
Yeah, of course.
Again, shopping center, Micronesia Mall, GPO, and a lot of the other retailers are open. There are some exceptions, noticeable exceptions. Macy's, Ross, Tommy Hilfiger, and Calvin Klein. Some of them are waiting for corporate protocols to be put in place.
Oh my God, I thought Ross was open this whole time in Macy's.
Yeah, no.
I was wondering why my people weren't buying me anything. Thought they forgot about me because of the COVID. But so those aren't okay. That's good to know, Kathy.
Yeah, so they're not quite open yet. They're preparing their facilities. to meet the guidelines. So, putting up the sneeze guards and making sure that their employees have PPEs and, those sort of things. So they want to make sure that everybody's safe, their customers, their employees. So those openings will be a little bit later, maybe towards the end of the month or
How does it work?
of next month.
So when they get the protocols, are you just good to go, or do you need to call public health or anything?
Well, the protocols have already been vetted.
Okay.
So what we've between us and public health and the Women's Chamber, we've got all of the guidelines posted on our website. So they're readily available for anybody to go through.
Catherine, I'm wondering, right? So we reopened with PCOR 2. More businesses have opened their doors. But driving by GPO the other day during what I thought would be maybe, not a peak time, but I didn't really see anybody in the parking lot. So we've opened, but have they come?
That's a good question. The people, from my understanding and speaking with Monty and speaking with the folks at the other places, is that they have seen people, but they're the main areas that people congregate to. There's no loitering allowed anymore. People can go to, for example, the food court at GPO, but they can't stay and eat.
Mm-hmm.
So those types of things that, shopping malls are a place for people to gather.
Yeah.
They're a place for people to hang out and meet people and people watch and do shopping, but window shopping perhaps. And so because we're still in PCOR 2 and all of these, there's still limitations put in place. So there's not going to be the crowds that we were expecting to see. And we understood that going in.
Right. And I think even with GPO, they've kind of changed up how they're doing business in terms of some of their businesses now. They've kind of leaned towards online shopping.
Mm-hmm. Did you notice that a lot of the retailers have adjusted the way that they do business because of the current, pandemic situation, and moving forward is going to be a new way of how we experience, retail shopping, right? And it's going to be a little while, and I don't even know if we're going to go back to that same way that we have done retail therapy before.
Mm-hmm. Yeah. I wanted to get back to PCOR 2, and are you seeing some of the businesses that, like the gyms, the spas, that can be open? They just have to come up with their plans. Are you seeing them starting to submit their plans for reopening during PCOR 2?
Everybody, these businesses have been awesome. All industries, including like dog grooming, dance studios, gyms, salons, they've all submitted their guidelines ahead of time. When they knew that PCOR 2 was coming up, everybody submitted guidelines, and they were all vetted against national guidelines for their particular industries, and as well as the CDC and public health guidelines. So those have been put in place. Even golf courses, tennis industry, you name it, shipping, what do you call those, fishing companies?
Mm-hmm.
Everybody has submitted. So it's just a matter of when certain guidelines will be relaxed, when these other groups like dance and gyms can be open.
Right. Who makes that decision? Public health, or
it would be public health and the physicians advisory group. That's my understanding.
Wow, Kathy. So with the openings, right? How are the businesses dealing with how many staff to have versus being open but nobody's showing up, or very few people are showing up? So I'm pretty sure that's quite the juggling act.
Yes, it is, and everybody, we all, we're all, me personally, I'm just, I'm heartsick about not having our people employed and have that opportunity to get a steady paycheck. And I know it's difficult for everybody, but I think that the businesses are doing what they can to to stagger the work schedule so that people have opportunities. So those things are in place. Obviously, the ones that are hurting the most are those that are in the hotel and visitor industry. So that's a little ways down the road.
Mm-hmm. What about in terms of your membership? How many of the businesses have officially just closed down as a result of being a casualty of COVID?
Mm-hmm.
You guys keeping track of that?
We only know our members, right? So we know that Fruits is closed at the Agana Shopping Center. So that was their only business outside of. I know that they have facilities on the Anderson and Naval Base Guam. My understanding too is that Royal Orchid will not reopen as a hotel. So those are the only two that I know of for sure of our membership that have closed their doors moving forward.
Okay.
I know that there are several of our members that are still closed, but it's only because of the restrictions that are in place.
Mm-hmm.
Right on.
What about the PPP? Are you guys keeping track of like how many businesses? Because I think it was 508, right? That received PPP. But since the was it CARES Act 2 or 3, whatever we're on, the new PPP funding that was provided. Do you guys know how many have applied and have been approved?
At this point, I don't. That information is provided by Ken Lujan from the SBA. Yeah, and my understanding is there's still some money available, but I do know also from the lenders that they are swamped with applicants, and so they're still going through applications.
Wow.
Yeah, I know.
Now, I know that you guys sent out a newsletter, and there's quite a bit of information. There's one here. There's a webinar series that you guys are going to be hosting.
Yes. So, Sabrina, I don't know if you know, but we've been keeping the members abreast of like almost every step of the way since February, because like we've mentioned before in our chats that we kind of saw this coming, right? We wanted to kind of get ahead of this. So we've been keeping the members abreast, and if you take a look at our website, you can just see like all of these. We have links to all of the notices that we've sent out. But we've developed a webinar series, and this is the 4th one, and we're really excited about it because it's talking about our mental and emotional wellness during this crisis. And so Risha, again, who is also a member, has graciously agreed to conduct this webinar. So we're really excited to have that on Friday.
And this is open to just members?
Yes, it's open to everybody.
Okay.
Right now we've been having these webinars, and they've been open because, we understand that people need whatever help that they can get. So we've had attorneys on, we've had SBDC and SBA on. And we did that virtual town hall.
Yeah, that was actually pretty good with the women. Yeah, the Women's Chamber of Commerce.
Women's Chamber, yeah. So these we've made available for free because we know that our people need what they need, and so we wanted to do this. This is what we do.
All right. Anything else you wanted to say?
Well, I just again wanted to thank everybody.
Man, Kathy, I'm sorry. I just can't believe Ross. I thought Ross was open. Sabrina she was like gonna, and you're right. You can't loiter, you can't gather. And I've been to Ross. There's no way to just beeline and Ross. You don't ever go like I'm gonna go to Ross and I'm gonna get one of those cute little like paintings that everybody has. And then I'm going to go out. No, Ross is take your time,
Yes, go through every
Right.
nook and cranny. I agree, and then
I just thought they were going to do it. I thought it was going to be okay, you only can have 20 people in. But you're again saying that the corporate guidelines with Macy's International or whatever and Ross.
Yes, yes, yes. And then there's also this national, the National Retailers Association that, has all of these guidelines in place. So everybody wants to make sure that people feel safe. And then that's the thing is, before we could even have, invite visitors to come to visit us, we want to make sure our family and our friends and our people are comfortable here and safe. And so that's what we need to do as a community. So we're, as much as, we miss going to Ross and we miss going to Macy's and Tommy and all of those great retail shops, we just have to be just a little bit more patient. And I'm sure that, they'll be even better places to go for our shopping experiences.
All right.
Thanks, Kathy.
Thanks so much, you guys. Take care, all right?
You too.
All right.
Okay, Kathy, wash your hands.
You too.
Okay.
Bye.
All right, as Kathy mentioned, they are having a webinar. It's the latest in the series of webinars that they've been having. Tomorrow, there's one with Risha Uggan. She's a licensed professional counselor. She will be discussing mental and emotional health during this crisis. It is free. It's tomorrow at 10 in the morning. I guess just go to the Chamber website for more information on how you can sign up for that.
All right, it's containing COVID 756. Just a few moments away from jumping over to KUAM TV 11. Good morning. There was a comment here on the Facebook from Ben. So, Chris and Sabrina, is there any update on a press conference today? Why is this administration keeping the people of Guam in the dark? We are in this pandemic situation and no information coming out from our governor. This is not the way to run this government. Not informing our citizens on a daily basis because even our news reporters can't even get anything from this administration. Well, it's funny that you mentioned there is
a press conference.
I got it.
You do?
Yes,
There is?
sorry. There is. So the Adelou Policy Director, Carlo Branch, has confirmed that there is a press conference today at 2:30.
2:30?
2:30, yep.
Okay.
Well, there's going to be a big, huge announcement.
What's the big
That's all I'm going to say.
announcement?
Nope, don't
I know
ask
you
Sabrina.
know.
Don't. No. So you guys are going to watch this big press conference. It's going to be on a KUAM News Facebook as a legitimate Edward R. Murrow award-winning social media source.
Legitimate.
Very legit. Too legit to quit. Nah, we ain't going anywhere. 7:58. So what we are going to do, though, is take a little break. We got the day's COVID-19 headlines coming up. The Superintendent John Fernandez. Also going to talk to Major Tom from the Salvation Army. Senator Sabina Perez, who's prepping for an oversight hearing next Thursday.
There's an oversight? I missed that.
Yeah, well, we had her on. Remember, she said she was going to call for an oversight hearing.
No, I know.
Right.
I just didn't know that one had already been scheduled.
Well, she messaged me yesterday. Yes,
That
Thursday.
she scheduled one. Okay,
Yeah.
I didn't see the release then.
Okay.
I know that there's that briefing today. So
Right, so there is a briefing. Is that with the speaker?
yes, an informational briefing. I guess whoever the governor designates to appear before, or not appear, but talk via Zoom to the legislature to give us, the people of Guam, an update on a COVID-19 response.
Right, and from talking with representatives from the speaker's office, I think what's going to be interesting is not just who shows up to the hearing. Is that at 9?
9.
At 9 a.m. this morning, but also who doesn't show up to the hearing. Okay, so 7:50. Got to do that with more. Dun 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 dun. 7:59. Again, we're containing COVID. The KUAM News Takeover, Guam's favorite. We'll take a break. Coming back with more of this multimedia broadcast extravaganza. Good morning on you, Guam.
Class of 2020.
healthy. Be informed with ITD.
Keeping you informed, KUAM News brings you Banking 671, brought to you by the Bank of Guam, the People's Bank, and Coast 360 Federal Credit Union. Together, we thrive.
KUAM News COVID-19 Takeover on I-94 FM is presented locally by Ambrose Inc.
Self-storage, conveniently located near the Harmon McDonald's. We offer affordable rates, online payments, and auto bill pay for your convenience. Plus, gate access daily from 6 a.m. to 9 p.m. Call us today at 648-7867 for more information.
With the new challenges we're all facing, First Hawaiian Bank wants to make sure you have access to your financial world. With FHB Online and our mobile app, we hope to make banking the least of your worries. Visit fhb.com/digital.
Be healthy. Be informed with ITD.
is not the time for us versus them.
GMH Administrator Lillian.
University of Guam, Dean of Nursing, Margaret.
There is light at the end of the tunnel.
Help is on the way from a marine medical.
Out in the public, where all are more exposed.
585 have tested positive.
Take it away, Bree. Hey, good morning, 807. We're KUM FM in Agotni, Guam. It's the KUM News Takeover, Guam's favorite, I-94. Good morning. Good morning, Guam. Thursday. I know what you guys are doing today. You're checking the mail. That's right. Again, 808, the show proudly brought to you by Cabo Enterprises, Coast 360, IT&E, Ambrose, and the Bank of Guam. Good morning. Coming up, Superintendent John Fernandez of the Guam Department of Education, and a whole lot more on containing COVID, where there are just so many ways to catch the multimedia broadcast extravaganza, of course, right here on the radio, I-94, Guam's favorite. Want to thank Andy Wheeler and our I-94 family for allowing us to move in here, shacking up on Guam's favorite. Also, there's a live stream, KUM.com, on the KUM News app. There's an audio stream, Docomo Channel 10. We're now live on KUAM TV 11.
Good morning.
Good morning. And last but definitely not least, on the award-winning social media networks of KUAM Facebook Live or KUAM News Facebook page. Good morning to all of our viewers, listeners, questioners, commenters. Thank you guys so much. It's 8:09 now. Let's do a dive into the COVID-19 headlines from the KUAM News team. Sabrina Salas-Mantanani, good morning.
Hafaday, good morning, everyone. The latest from the Joint Information Center released just before 10 o'clock last night. 87 individuals were tested for COVID-19 on Wednesday. 0 tested positive. The results include samples from clinics, the Guam Memorial Hospital, the quarantine facility, and samples from the COVID-19 expanded testing at St. Dominic's Senior Care in Barrigada Heights. The number of confirmed cases remains at 152, 5 deaths, and 124 recoveries. Expanded testing will also be held this Friday at Gura Public Housing in Lower and Upper Agate and Maritzo. The testing is for those with COVID-19 symptoms, including multi-generational families. It is free and is from 9 a.m. to 12 noon. You are urged to bring an ID. The Department of Administration Director Edward Byrne has got his marching orders and firing up the computers to push electronic checks to vendors for their efforts in containing COVID. Here's more.
DOA Director Edward Byrne got his orders from Governor Lulian Guerrero.
There is a formal instruction I have
The formal instructions came via a memorandum signed by the governor last Friday, May 8th, citing her Title X special powers, allowing her to make emergency purchases to respond to a public health emergency.
I know that we're having to do things in a different way, all of us, right, because of this pandemic.
Different in that invoices are being paid even though signatures are missing on several emergency purchases that were posted on the governor's website. Matter of fact, every emergency purchase on agreements between Guam Homeland Security and the Office of Civil Defense for the quarantine isolation facilities are missing the signature of the agency's director, Charles Esteves, certifying officer Marie Kenga, BBMR Director Lester Carlson, the Attorney General, and the governor herself. What was attached to every agreement was the May 7th memo stating the governor's Title X special powers.
So these don't have to have contracts, right? Just as long as you got the invoice, you don't have any other you don't have to have any other paper trail justifying anything. Like no agreements are in place. It's okay just as long as the governor says, go pay this. And here's the invoice.
This was an emergency procurement.
Right. Well, I'm just curious because Charles Esteves said, where's the contract when it came to Mr. Hyun sending over information about these food contracts, and Esteves is like, where's the contract?
Byrne was firm that he's received his orders.
I think it was like at the end of last week, I got an instruction from the governor to pay these invoices that were acquired under this emergency purchase.
Although Byrne didn't provide specific details about which invoices or how many he's paying, according to the governor's website, there are multiple emergency purchases and multiple agreements between GHS OCD for quarantine isolation facilities, beginning with Santa Fe. UNI are paying for 103 fully furnished rooms, Perlis Court condominiums, 17 fully furnished condos, Pacific Star, 389 rooms, Days Inn, 48 rooms, and Wyndham Garden, 144. According to these agreements, we're paying $100 per room per day, and even if they're vacant. The hotels are to take care of housekeeping, linen and towel service, providing their own labor and personnel, as well as the quarantine isolation hotels are responsible for delivering and providing 3 meals a day, 7 days a week. But if food services are part of the deal, why is there invoices on the governor's website to pay almost $80,000 to Capital Kitchen?
I think it does include food for those people that are staffing the hotels, but I don't think it's every meal. I think it's just whenever those staff are there, we paid for the meals for the people that are helping the people in quarantine.
Also paid was an invoice for laundry services from a company called The Laundry Solutions. But it wasn't the governor that gave the order, but rather her now former chief of staff, Tony Babalta.
Is she the only one who can tell you that? Because you said Tony Babalta also did. Is she the only one? And who else has?
Nobody else has.
So just Tony Babalta and the governor have ordered you to...
The governor is the governor, right?
Well, Tony Babalta was Tony Babalta. He's not the governor. But you said he called you up or he wrote something. Did he call you or did he write something and tell you to pay?
No, I think he called me.
Can you recall the call, Ed?
No. But let me just say this, and this is important, right? That if the instruction I have got from the governor was to pay whatever invoices were presented, and that means invoices that were presented and paid, and invoices that are yet to be paid.
UNI, in the meantime, will also be paying for medical staffing at the quarantine isolation sites. According to a memorandum of agreement between Public Health and Health Services of the Pacific, they were brought in to provide clinical surveillance of inbound travelers held under quarantine at GovGuam isolation sites. These include physicians, nurses, LPNs, and non-clinical support staff, to name a few. According to the MOA, they're being paid also for overtime and mileage reimbursement. While the MOA was signed by HSP, it wasn't signed by Public Health Director Linda N. Pinko DeNorsi. Although we don't know just yet how much all these emergency purchases will cost UNI, as the governor has said in the past, quote, "It is what it is."
The normal rules don't apply in these circumstances.
The question, however, does remain, will it stand up to GovGuam's requests for federal reimbursement? We should also note that almost all of the quarantine isolation facility agreements have expired or will expire in the next several days. KUAM has also learned that a new round of emergency purchases will be done for quarantine and isolation facilities, but this time with the assistance and guidance from Civil Defense and GSA to ensure proper protocols and procedures are met. Reporting for Guam's News Network, I'm Sabrina Salas Matanani. Reporting for Guam's News Network, I'm Sabrina Salas Matanani. At 9 o'clock this morning, the governor's designees are expected to provide an informational briefing to lawmakers via Zoom on the government of Guam's response to COVID-19. Public Auditor B.J. Cruz will be conducting audits of COVID-19 pandemic procurement, Adeloop's CARES Act budget, and COVID pay. Cruz says his office is currently finalizing financial audits, but engagement letters seeking information and documents will go out to pertinent parties next week. He tells us that 3 audit teams have been established to review the emergency procurement of hotels as GovGuam quarantine facilities, proposed expenditure of CARES funds, and public employee pay issues relative to double pay versus COVID differential pay. The announcement of audits comes after former Governor Eddie Calvo called out Cruz and Attorney General Levin Camacho for their silence on controversial issues surrounding the Leon Guerrero Tenorio administration's handling of COVID emergency purchases, procurement, and other issues that have made headlines recently. He adds that COVID-related audits were requested by several senators and news media. In the CNMI, Governor Ralph Torres, the Commonwealth Healthcare Corporation Chief Executive Officer Esther Muña, and the governor's COVID-19 Task Force Chair Warren Villagomez unveiled the CNMI Community-Focused Economic Recovery Plan. This new policy outlines a phased approach to reopening economic activities in the Commonwealth, developing guidance to protect businesses and customers, and ensuring compliance with public health directives intended to safeguard all residents in the Marianas. One highlight of the plan includes the proposed resumption of tourism on July 15th. In national news, House Democrats unveiled a new coronavirus relief bill. The previous plans all passed with bipartisan support, but this bill was crafted without Republican input, and GOP leaders are saying it has no chance to pass the Senate as is. Natalie Brand has more details from the White House.
The House could vote as soon as Friday on its latest coronavirus relief bill. The $3 trillion package includes up to $1 trillion for state and local governments, $200 billion in hazard pay for essential workers, and a second round of $1,200 stimulus payments for individuals up to $6,000 per household.
There are those who said, let's just pause. But the families who are suffering know that hunger doesn't take a pause, the rent doesn't take a pause, the bills don't take a pause, the hardship of losing a job or tragically losing a loved one doesn't take a pause.
But Republicans have already declared the Democratic proposal dead on arrival in the Senate.
We're going to insist on doing narrowly targeted legislation, if and when we do legislate again, and we may well, that addresses the problems.
The White House Coronavirus Task Force is scheduled to meet this afternoon. Dr. Anthony Fauci and the head of CDC say they will now resume attending White House meetings in person as long as they remain asymptomatic, wear face masks, and practice social distancing. The health experts testified remotely before the Senate yesterday about potential consequences for states reopening without meeting CDC guidelines.
There is a real risk that you will trigger an outbreak you may not be able to control.
My message later today will be that we really need to build contact tracing around the country. That's going to be our key capacity for the next 6 months to a year.
Dr. Tom Inglesby from Johns Hopkins University is one of several health experts testifying this afternoon as part of the first hearing from the House's newly formed Coronavirus Oversight Subcommittee. Natalie Brand, CBS News, the White House.
671 report, according to a new article, Reimagining Banking During and After COVID-19 by Jim Morris. The banking industry was much stronger before COVID-19 than before the financial crisis of 2008. However, the need for different strategies around marketing, innovation, and digital banking was clear well before the pandemic hit. The question becomes whether financial institutions will remain committed to new banking models post-crisis. Before COVID-19, the banking industry was experiencing an unprecedented period of growth and prosperity. Despite increasing consumer expectations and increased competition from non-traditional financial institutions, most banks and credit unions were stronger than in any period since the financial crisis of 2008. In a matter of only a few weeks, the world of banking had experienced a level of disruption that will change everything that had been the norm in financial services. Banks and credit unions must use this time of disruption to consider reinventing themselves from the inside out. It is a time when we need to better understand the way consumers expect their financial institution to support their financial needs. For more on this topic and others, go to thefinancialbrand.com. And that is your Banking 6711 report, sponsored by Coast 360 and the Bank of Guam.
All right, thank you very much. 821, again, containing COVID. Moving right along here, let's get the superintendent of the Guam Department of Education, John Fernandez, on the line. Good morning, John.
Hi, Happy Chris. Happy Sabrina.
Hi.
Just, want to check in with you weekly. What's the latest with the Department of Education? God, that's such a loaded question, though.
Yeah, I think every day we kind of reflect on all the things that have to get done, not just to support our community during this current crisis response, but looking ahead, we thinking about recovery, trying to coordinate with our fellow agencies and the governor's office. I think our budget hearings are coming up for next year. And then, of course, working with our federal partners to ensure that we maximize and take advantage of the federal dollars that we know will be coming our way. So, yeah, there's a lot going on. We're meeting every day, even though we're not physically always in the office. We're meeting, all hours of the day and morning and night to try to get things done.
I remember when we had you on, was there some discussion about some of the schools maybe trying to do something different for graduation? I mean, I know you canceled all the graduations, but is there been any development on that?
Yeah, we did have a meeting with all the high school principals. Of course, encourage them first of all to make sure that they were working with the senior classes and their advisors to get a sense of what people wanted to do in lieu of a traditional ceremony. We also did an Instagram live meeting with seniors just to get their ideas too. So it looks like the information I hope will be finalized by the end of this week, and we can get it out to the public. But it looks like all of our high schools, as well as JP Torres Success Academy, are going to plan some type of drive-through graduation for their seniors. I believe it'll probably be coupled with some kind of virtual component, whether it's live streaming of the ceremony itself or just a separate kind of virtual ceremony, an acknowledgement of the students. So those details are coming together. They will have particular dates and time frames set aside, and we'll want to announce that to the community and let our folks know where they can go to maybe watch the ceremony online or otherwise congratulate our class of 2020.
What's the update on FB Leon Guerrero Middle School and testing that was conducted there? And it was shut down.
Right. So my understanding is that this week we'll complete the quarantine time. We don't have any. We're not aware of any positive outcomes due to the testing of the employees who were there. We did that as a matter of trying to be as cautious as possible. We did shut down the site in order to make sure that we could clean it adequately, and then also allow, even though there were no positive tests, there still was a quarantine period for those who may have come in contact with someone positive. So we just gave it the 2 weeks, and we'll make a decision shortly about whether we can reopen next week, depending on ensuring that the facilities are ready to go.
Mm-hmm.
So we'll try to inform the public as soon as we can make that announcement.
Mm-hmm.
John, was there a decision that came down about the extension, of the grab-and-go meals? Because I know you guys have been trying to run it through the summer. I may have missed that.
So we're in active discussion with USDA, and really what it comes down to is that under the rules of the program and of the supports that we're providing, the U.S. Department of Agriculture is looking for assurance that there is continuing to be an educational component throughout the same period. So we're in the final stages of designing the summer school program, as well as continued distance learning that will definitely take us up to the beginning of the school year. So we don't see any obstacle, really. It's just a matter of getting that assurance to USDA, and basically what I'm waiting for is to finalize those details, announce it to the public, and that announcement in and of itself should satisfy the federal agency and allow us to get that official approval.
That's good.
But our intent is to try to continue this operation right up until the start of the scheduled school year.
What about, I think I remember reading that GDOE was awarded, I want to say over $40-50 million in federal grant money?
Right. So under the CARES Act, which is, is meant to support some of the, this COVID-19 response, the Guam as a whole received $54 million in education funding, and around $12.5 million is kind of put in the governor's education fund, and the governor will determine how to use those funds. And then $41.5 million is going to the Department of Education, that's a state education agency, to use for both public and non-public schools to support COVID-19 response and getting us ready for the next school year, given the focus on distance learning, mental health support, protective equipment, and so forth. So we just got off a call this morning with the program office to clarify the rules, the process for applying for and receiving the funds. What our plan right now is to spend the next week working with our stakeholders to get a handle on what the priorities are for the various partners that we have in our school system. That includes we've got the students conducting a survey of their peers. We're going to schedule an island-wide PTO meeting, working with the non-public schools as well as our administrators and other stakeholders. So our plan is to try to get as much input as possible and not really try to do this behind our closed doors. We want to make sure we get that input and people understand what the funds are for, so that when we put an application in, it's really clear as to what we're hoping to accomplish. So,
when you say non-public schools, are you talking about like reaching out to Juan Flores?
Correct. So
okay.
Every year we get formula funds to USDOE that entitles our non-public schools to equitable services under those grants. So when we buy computers, we don't just buy them for our public schools. We also provide an allotment to the private schools, including our Catholic schools, including Harvest, St. John, St. Paul's, whichever the schools that want to participate. And so that'll be a similar case. And we know that everyone's kind of hurting due to this crisis. So we're hoping that we can get their input, factor that into our application, and then get the support and be able to monitor and ensure the effective use of those resources.
Mm-hmm. You said the governor's office, the governor gets $12 million from the funding that you guys receive. What is their guidelines on what she's supposed to spend it on?
Right. So the $12.5 million is above and beyond the $41.5. So it'll be a total of $54. So the $12.5 million, it's similar. It's to support education, but I think it's given a little bit broader flexibility. I think it goes all the way from childcare centers all the way up to colleges, to institutes of higher education, including the GCC and UOG potentially. So I've pledged to inform them as to how we are looking at allocating our funding, how we can coordinate the funds, and help them in their planning. But obviously, it's up to the governor as to how they want to deploy those education resources.
Well, so you don't just get the money in your GDOE account?
Actually, we will for the $41.5. That will go directly to the agency. But again, that comes through an application process.
I see.
Apparently, once USDOE gets the application, understands what the uses are for, gets all the assurances that will follow the rules, then they will, I think within 72 hours, possibly be able to approve and allow us to draw down those funds.
So how soon are you going to submit that application?
Well, we're hoping to spend the next several days, so into next week, meeting with our stakeholders and ensuring that we've reached out and gathered their input. And then I'm hoping that we could turn the application in by the end of next week or early the following week. And then within that 72 hours, it looks like a 2 to 2.5 week process, hopefully, to get their approval and get the funds in the door.
So, okay, I wanted to switch subjects. What are you guys doing? What are you looking at for the upcoming school year if students are going to be returning to campus to maintain social distancing? Because if you have X amount of students in a class, say it's 30, how are you going to fit 30 students in a classroom while maintaining this 6 feet away from each other?
Right. So, obviously, we've got a recovery team in place that's going to work through these issues for us, and breaking out the.
I'm sorry, GDOE recovery team.
Yes.
Okay.
Yes, and so.
Sorry, there's so many.
I know. We got our folks working on it, and as part of it, obviously we have sort of different issues that are priorities, but the number one issue is safety. And so, I think the safety committee and the operations, that have to, be conducted in order for us to open any of our facilities, that comes first, and that will have an impact on everything else, including distance learning, how we allocate our personnel resources and so forth. So that's the committee that's got to move quickly, and they're moving to identify, what's needed in order to be able to get to a point where we can say we can open a facility at all. I mean, that's going to depend on the island-wide PCOR, status being at a point where we can open. But once we get to that point, it's not going to be like just flipping a switch and we're all of a sudden back to normal. Right now, we're looking at the social distancing requirements, and we are having our schools. The plan is to get our school administrators to kind of work through their facilities and understand what the capacity is at the classroom level, the cafeteria level, and so forth. If we're required to meet those social distancing requirements, definitely that's going to raise the issue of how we bring students into onto campus, and whether we need to have staggered schedules, staggered days, for them to physically show up. I mean, already that shows you that we're going to have some hybrid form of on campus and distance learning going on at the same time. So so for instance, if you're on campus on Monday, Wednesday, and Friday, but not on Tuesday and Thursday, we're not going to say you're off on Tuesday and Thursday. We want to make sure that we continue the teaching and learning components. And so we're kind of working through that and looking at what staggered schedules might look like. I think that the other components, we're going to need a lot of training for staff, teachers, administrators, before we even allow the first student to come back to school. So we need to budget time early on so that we can talk about safety protocols, talk about distance learning and how we are going to implement it, make sure everybody's on the same page before we even allow the first kid to show up. Personal protective equipment is really going to be one of the critical challenges. How do we ensure that every student and employee has adequate supply of personal protective equipment, and how do we source that? So we're going to move quickly right now to identify potential sources and let them know our needs so that we can get those resources in the door. So I could go on and on about the various components. The impact on teachers if they have to deal with a staggered schedule.
Wow.
Looking at all the equipment and accessibility issues related to distance learning, and then mental health supports and so forth. So there's a lot on the plate. But I think as we get further along, we'll be sharing it with the public and working with the governor's recovery team to coordinate to make sure we're on the same page.
Wait, so this the recovery team you were referring to? This is the governor's education recovery team, or?
Yeah, no, it's I'm talking about, we have our own internal
recovery team. Okay.
Recovery team, and we're planning. Yeah, it's basically focused on our school operations and how do we even operate under a recovery scenario, because we're just a very complicated organization, lots of personnel, lots of facilities, and we've got to do all that planning down to the very finest detail in order for me to be assured that we can open up.
All right, so I guess we're going to need to keep in touch with you a little bit more often.
Yeah.
Yeah, no, it's picking up steam, and right now it's a matter of closing out the school year, but we're making that shift already and say, look, we've got the recovery discussions in place. So as we close out that school year, we're going to shift right away towards, getting facilities ready in the event that we have to or are able to reopen, and then making sure that we work with everybody to adjust and modify our practices, because things are going to be different this school year.
Are we looking at mandating masks?
Well, again, like under this current, if you ask me
for
today,
students,
right. If you ask me today, everybody needs a mask,
right.
And I'm not gonna, we're not gonna be comfortable without that in place. So, looking at that, I mean, questions like whether we're going to have sufficient funds to provide. Does the department have the funding to supply a mask to every student every day of the school year? Do we want to make it part of the uniform policy and work with the vendors to have a cost-effective, option there. So as they produce uniforms, they can at least throw in some masks. Those kinds of discussions have to take place now, and so that's what we're working on.
Man, and John, I'm pretty sure if all our kids are getting free meals, I mean, the mask and being able to afford one, that's definitely going to be an issue, I think.
Right. So we're definitely going to have to think about that and how we can fill the gaps that are out there. And in addition to all of this, I was just laughing with the team. I said, it's not funny, but in addition to recovery, we're going to start hitting typhoon, season at some point. Oh, Lord. And how are we going to move into a sheltering operation under social distancing, right? I mean, there's like a lot of other things that we do that are going to be impacted. We are supporting the community through food supplies. We get commodities from USDA, and if you look at all the laws that have passed and are being contemplated, it looks like a lot of funding and resources will come through those programs to push food out into the community. So we're kind of thinking about how DOE can play a role in a more comprehensive food support plan, because we get all these commodities coming in and need to get them out. So we're working with Frank Blas's group that'll be out today, distributing food commodities at 3 different sites. There are other vendors who want to work with us to help us. So we'll keep letting the community know where they can come for food support.
John, you mentioned this briefly early on in our discussion about how you've got so many things up in the air, so many priorities right now, and one of them you said that you guys were preparing for budget, right? The GDOE budget.
Right.
How are you guys going to have to change the budget that you're presenting, because you guys have a big list of things that you're going to need, but the way it is now, from what I understand, there's a $1.5 million you're short from the Territorial Facilities Fund?
Well, we've had that in the past. I have to double check, because I understand we got some allotments and we got some funding from the TEF recently. But I would say that as we enter the budget discussions, there's going to be I don't know if you use the temptation is the right word, but there's going to be discussion about the federal funds that are coming in. Whether that will provide relief for the local budget because of the revenue situation being worse than projected, and we'll be a part of that discussion. I think in our discussion with USDOE this morning, we understood that as part of a condition of our getting the $41.5 million, there had to be a maintenance of effort on the local government side to provide at least the same level of funding that was provided in prior years for education. So I think on that note, I'm going to have to inform, the governor and legislature that that's a requirement for us to access the additional federal funds. But I understand there may be other funds coming down. I know there's this HEROES Act that's being looked at in Congress that might be able to provide, states and local governments some of the relief to address the shortfalls in revenue, and maybe that's a way in which, our governor and legislature can allocate those funds to make up for those shortfalls. When we go to our budget hearing, we're just going to say this is what we need. We're not really in a position to say that the revenues are going to be, here or there, because we're not in that business. That's someone else's role. But once they give us our budget, we'll have to make the adjustments, as we always do, to deal with our needs and maybe forego our wants. And maybe the federal funding coming in will help us address those extras that we don't usually get.
Mm-hmm. Okay.
Wow, there's a lot. I was just messaging Adriana like, hey, did you check this interview? There's like 58,000 stories in it.
Well, the other thing about it, even in recovery, we're talking about our internal team, but there's definitely a need for partnership. So I did reach out to Ricky Hernandez. I know he's heading up the governor's efforts, and let him know that we just, let's just stay coordinated, because I don't want the community to think that once we go to a PCOR 3 or PCOR 4, there's a switch that turns on and we're open already. We're going to have to talk about that gradual transition into an open school system. And I want to make sure, because we have such a large group of stakeholders, we don't want misinformation or rumors or other things going around about when school starts and who needs to report and how. So definitely I want to keep that coordination. Internally, we're working hard, but I just informed it. I mean, I talked to the team. I said, is DPW involved? Because I hadn't even thought of this, but if you're thinking about 6-foot distancing on a school bus, there's a whole set of implications there as to how we're going to get kids to school. Right. So we're going to have to work together and really coordinate closely.
I'm surprised
to make
you
it
guys
work.
aren't working together like right now.
Well, I think right now we're gonna allow the governor's health to address the health situation. I think PCOR 2 was meant for every agency to get their plan together, and so we definitely are going through that and every the finest details. And but we are staying coordinated, and I let them know that we're ready to meet when they're ready to kind of think about that transition into PCOR 3, so we can let them know what our plans are and then ensure that there aren't any issues that remain. So,
Did he
I
respond?
think that'll happen soon.
Did he respond?
Oh yeah, we were on the phone, and no, he's well aware. I mean, he's a big supporter of our school system, has been in the past. Very well aware of our situation. So, we have a good working relationship personally, and I know that when the time comes, he understands we're doing our work, and when it comes, he'll help pull together the necessary agencies to coordinate. So I don't have any fear about that. It's just a matter of us having a little bit more time to pull our part together, and then we can work with them.
Well, thanks, John, for that progress report.
Right. I felt like that was a state of education address.
Right. No, I think, again, as we close out the school year, I understand there's going to be a lot of questions now coming about what's next, what's happening, and we'll be prepared to provide more public updates as we get to that point. So this is just scratching the surface of what we're doing, and we're happy to follow up, and we can do something on a more regular basis.
Yeah.
As needed.
Yeah. Thank you, John.
Appreciate it.
All right. No, absolutely. Thank you.
Okay.
Wash your hands.
Take care.
Yeah, definitely. Stay safe. Bye-bye.
8:42. We'll take a little break, and coming back with more of Containing COVID right here on Guam's favorite, I-94.
Join. Be healthy. Be informed with ITD.
Keeping you informed, KUAM News brings you Banking 671, brought to you by the Bank of Guam, the People's Bank, and Coast 360 Federal Credit Union. Together, we thrive.
KUAM News COVID-19 Takeover on I-94 FM is presented locally by Ambrose Inc.
GU Self-Storage, conveniently located near the Harmon McDonald's. We offer affordable rates, online payments, and auto bill pay for your convenience. Plus gate access daily from 6 a.m. to 9 p.m. Call us today at 648-7867 for more information.
With the new challenges we're all facing, First Hawaiian Bank wants to make sure you have access to your financial world. With FHB Online and our mobile app, we hope to make banking the least of your worries. Visit fhb.com/digital.
Be healthy. Be informed with ITD. Be healthy. Be informed with ITD.
case you didn't know, we are a legitimate media source.
Too legit to quit.
846. Good morning. PCOR 2. A little bit of micronation in case you didn't know. Good morning. Boy, as you know, I'm pretty sure you did know, we've been following this pandemic procurement and emergency purchasing that's been going on. Sabrina Salas-Mantanani, a great story last night, and sifting through an avalanche of documents that we received by way of Freedom of Information Act request. And, one of the things that you pointed out in that story that you did yesterday, Bree, was that the administration has put out these memorandums and these contracts and these invoices, and basically, like you said, told Ed Byrne, pay the stuff. Right? But I thought it was really interesting in your story how you had brought up that none of this stuff was signed.
Right.
I mean, some of it had some signatures, and then
some were just invoices with no contract.
Right.
But yeah, the contracts, especially for the hotel isolation quarantine facilities, they didn't have signatures on them from like Charles Esteves,
Right.
I think Marie Kenga, the certifying officer.
Correct.
It didn't have signature from the Attorney General. It didn't have a signature from BBMR,
Right.
and it didn't have a signature from the governor.
Right.
So,
in looking at these emails that we FOIA'd, there was one particularly for the food services that there was a chain with the governor's legal counsel to the civil defense administrator, Charles Esteves, where basically Hai Hyun was like, hey, we got all these meals. There's meals going here, meals going there, here a meal, there a meal, everywhere a meal, but only for the cabinet, catering of the cabinet's eating good. Basically Hyun was like, hey, deal with this to pay the man. And Charles Esteves' response to the vendor was, well, show me the contract, show me the invoices. And so if in tracking the timeline of, and I'm just using the food as an example, because I think the same circumstances apply to all of these memorandums and invoices and contracts that Ed Byrne is being told to pay yesterday. They took it outside of that process where it required that civil defense and homeland security involvement, and put it now in this other lane where they can fast track it and not have to worry about who doesn't want to sign whatever.
right, and I did message the Attorney General's office, Carlina Charfras, to get a comment on whether or not the AG's signature is required on these documents. And, the response, I couldn't get a yes or no. One of the responses was that this is not the normal course of action for contracts, but the Gov cited the law, which allows her to do what she did under these out-of-ordinary circumstances. So, of course, I said, well, is that a no? Then the response was the law says the governor can suspend certain provisions. And again, so I responded, is the signature now not required? Are you not able to provide a yes or no response? The response that I got, the question of what the governor believed her authority is should be directed to her. We're not prepared to give a legal opinion on the extent of the governor's authority when there is a public health emergency. My response, that's not what I asked. I asked if the AG is required to sign these contracts. The response I received, you are asking me a question that requires a legal opinion. The Gov cited her authority, and I've said that the law says the governor can suspend certain provisions. And I sent her a copy of the email with one of her, one of the AG's giving guidance, I guess you could say, to.
I don't know. I just feel like I wasn't really clear on what the gist of that answer was. It kind of seems like, oh no, the governor said she has the authority. The administration's backing her. That's that.
The AG did not sign off on them. The governor cited her legal authority to execute those contracts. And then, of course, it just kept on going.
Right.
Yes or no, yes or no.
Yeah, so I was just thinking in my mind, if you're an independent elected AG and, maybe an administration says, hey, we can do this, then you might want to be like, well, let me just check if you can do that.
No, yeah, you're right. I did ask, will the AG
Not
conduct
just like,
a review?
Oh, get out of the way, go ahead, go for it.
Will the AG conduct a review of the entire process and vet it for legality, compliance, and quality control as an independent elected attorney general?
Can you repeat that question that we sent again? That's a good one.
Will the AG conduct a review of the entire process and vet it for legality, compliance, and quality control as an independent elected attorney general?
And what was the response you got?
Actually, I got a call at 8:37 p.m. last night.
Okay, so maybe that's something they have to tell you over the phone. That's not a texting thing.
Yeah, I'd like my response in writing, please.
Yeah. And so we wanted to bring, he is the Office of Civil Defense Administrator, Charles Estevez, onto the show and kind of get his take on things. And, Charles, first of all, we really appreciate the opportunity to speak with you.
Hey, half a day.
All right. Yeah, I just want to know why didn't you sign any of these agreements?
Well, the process wasn't done through GSA, so if it wasn't done through GSA, then, we can't certify documents without a GSA contract, purchase order. And so, if it was done during the height of the event, when we thought we're going to get thousands of cases and there's a peak, I'm pretty sure that certain people have to do what they need to do. But just on our end, with the emergency funds that we're given and charged with, if I'm given something and there's nothing from GSA, then we can't act upon it. Right. So when I was given the invoices from Capital Kitchen, and we tried to see if there was still the continued need for feeding, and so when Capital Kitchens called me up and said, how do we basically get a contract? And so I said, okay, let me see your last contract. Go ahead and shoot me your invoices so we know how much you're talking about. And when the owner told me that he didn't have an existing contract, I said, oh, okay, as of right now, please stop feeding. Because we can't, I can't tell him to keep feeding, because then we start incurring costs that, I'm just not prepared to pay.
Well, Charles, it kind of sounds like, and I don't know if this is an oversimplification, it kind of sounds like the governor's legal counsel, acting under the authority of the administration, that he was out here arranging all this stuff and then shooting it over to you, expecting you to kind of just rubber stamp it.
Well, so I can tell you that they've never asked me to do anything illegal.
Right.
Okay. Yeah. So and if you think about it, you have to look at the intent, right? So if I were to look at this from just taking my opinion out and just try to give my something without bias, is were they acting in good faith, or were they acting during the from what they believe to be for the best interest of the people? And it's kind of hard to tell, right? You have to kind of look at everything they did and see, was the threat really there? And so this kind of reminds me of this Pearl Harbor story, but I'm not sure if anyone's familiar with the story of George Allen.
You got the floor, Charles.
Yeah. So during Pearl Harbor, right there, the entire base, the island of Oahu is under attack. The base is under attack, and they're trying to get into the armory. And so all these soldiers are trying to get into the armory, and then what they found out is that the guy in the armory who wasn't out there, and the threat for this person wasn't realized, and they're trying to get weapons to fight back, and this person said, I can't do it without the authorization of the commanding officer. So they pretty much bum rushed the armory and took the keys and opened up and got weapons. So if you think about it like that, if people realize that there is a threat, they will do what they need to do to get the job done. But does it make it right? I don't know.
Well,
there's still a process though that we're supposed to follow.
I would think that if you should use your soldiers, right? You are in the war. You are on the front line when it comes to emergencies, not the governor's legal counsel. You know the rules. You know the procedures. You have been in the previous administration. You were Civil Defense or Guam Homeland Security Administrator?
Still Civil Defense Administrator.
Okay, so you know what you're doing, right?
Correct.
So why weren't you the one handling this?
That's a good question. But for every single other,
didn't you say at some point, like, yo, step back, Haig.
Stay in your lane.
This is what I'm supposed to be doing. We got a pandemic response plan. We should probably follow it.
I mean, it took, well, so the Guam Comprehensive Emergency Management Plan was enacted as soon as the governor declared a state of emergency. And so, I have hundreds of purchase orders that I've shared, hundreds of invoices that I've shared. And so you can see that emergency procurement was happening. I mean, it was ongoing for other things that we've needed. But for some reason, for the hotels and the feeding, I don't know why it didn't happen the way it was supposed to happen. But I can tell you now that, we're when I say we, talk about civil defense, we're working with GSA to get out contracts and purchase orders for quarantine facilities, isolation facilities, and any other services. So it's right now, it's whatever the process was, it's being recited.
So, Charles, just unpack this for myself mentally. And to use a metaphor, they're driving this car along this road, then they bring it to you, and you're like, oh, no, sorry, you got a U-turn. Thou shalt not pass!
Thou shalt not pay.
Right, and so then it looks like they took it out of that process where Charles Esteves is not going to sign it, and, we don't know now how that affects any federal reimbursement, and so now they moved it over to this, we're going to use the Health Powers Emergency Act, and we're going to get these people paid that way. So I guess my question is, involving you in the process and, Homeland Security and the Homeland Security Advisor from the beginning, following all the steps, jumping through the hoops, this is all done to ensure that we can be reimbursed and accountable to the federal government, correct?
Yeah, correct.
And so by moving it...
The FEMA reimbursement process, I mean, it's document heavy, right? So, they want to make sure that no conflicts of interest existed prior to. They want to ensure that written policies and procedures were in place prior to the disaster. So it's not a matter of just giving, what we have and explaining what we did. It's a process, and we've been through it many times. We still have open disasters for how long? We have open disasters for Dolphin, Mankut, and Wutip.
Right. And so now that we've moved it out of a place where Charles Esteves signs off on it, where, the feds got eyes on it, we've moved it into this Health Powers emergency lane. Does that mean that the people of Guam are just basically going to bite the bullet and eat the cost of all these services? Or is there... I'm not sure. So it really depends on what FEMA will accept in terms of paperwork and documentation. If a document's not signed or not executed, I mean, is it a legal document? I don't know. It really depends on when we do the exploratory calls, and we work with the FEMA recovery division to determine what's eligible and what's not. Right, and so these contracts, memorandums, invoices that the governor has wrote the memorandums for and sent them over to Ed Byrne, saying pay these. Is there going to be any reconciliation after they're paid, where they bring in, Homeland Security, they bring in Tim Uggan, and they're like, hey guys, can you make this right? Or is it just a done deal? Are you never going to sign any of this stuff, or is there a way to rectify it so that it's proper in your eyes?
Well, So I'm not going to sign anything unless I get concurrence from GSA, right? So if GSA is, if they're not going to agree, then it makes sense that we wouldn't be able to certify the funds. I don't know if that makes any sense.
GSA is what, Claudia Faji?
Yeah.
Correct.
Yeah. So in your understanding of the process, would GSA be able to go back and recreate this procurement record or whatever they got to do, and then to send it over to you in a form that's satisfactory, that you would then put your name on it?
Honestly, I don't know. I mean, because we're developing new contracts and new purchase orders for quarantine facilities and isolation facilities, I don't know if anyone's going to revisit the stuff prior to.
Okay.
Wow. So we're potentially looking at, we're just going to eat the cost of all this stuff.
I mean, if that's what needs to happen, then that's what's going to happen.
Wow, that sounds like an expensive. I don't know, what do you call it? Inexperience, a mistake, or is it a power grab? How do you classify this, Charles?
I just, like I said, I just go back to that little story of what happened with George Allen and Peter Allen. At Pearl Harbor, and just trying to do what people felt was best for the people at the time.
Right. Well, I don't, this isn't story time on this show right now. But I wanted to go back to. Go ahead.
So my mom once told me something, right? She told me that when you try to pretty things up with flowers, eventually the flowers die, and it just creates a bigger mess.
Mm-hmm.
My grandma used to say, "Don't put a lot of perfume if you didn't shower." It's kind of the same thing, right?
Yeah. So the thing is, it's no matter how many ways you packaged it, what happened happened.
Right.
I'm all about moving forward and
right.
trying
But man, Charles, that's a bitter pill to swallow to know that I'm not even sure we can recreate a record after things have been signed. So I wonder how Adeloop's going to face this, because it seems like somebody screwed up, didn't follow the process, and now we're just going to have to use our money. Or I'm wondering, is there a way that they can get it under the CARES Act?
That may be a possibility. I haven't read too much into the CARES Act. I'm not sure the exact breakdown. I saw that budget sheet that went down, but I could tell you that just from working with Leftover, the past couple of years, that he is a very fiscally conservative person. And when I say fiscally conservative, he didn't agree to
the decontamination, the cleaning.
Well, decontamination, feeding from the get-go, only because it's. And he asked, are we feeding because there's a need, or are we feeding, because it's a culture to feed, right, during these emergencies? And he was right. It's not a typhoon, and people can reasonably go out and get food. Maybe at the time when all the businesses were closed, people may have had trouble getting food or getting lunch. And food is reimbursable. It's reimbursable, but it really depends on the situation.
Right, but these contracts also said that the hotels shall provide labor, and personnel, and yet we had a cabinet quarantine hotel, Pacific Star, with our several directors.
Correct. And from what I'm tracking, the Capital Kitchens contract was for feeding of staff and security personnel.
Right.
But if that did go through Lester's desk, I just don't think he would have approved it, because like I said, he's very, very fiscally conservative, and he's a prudent person, and he would have said what's wrong with making a peanut butter and jelly sandwich before you go on shift. Mm-hmm. I'm just speaking.
Here's my lunch bag. Hey.
Yeah, and he's absolutely right. During a storm, it's different, because when we're in a condition of readiness too, and we're trying to tell people to stay off the streets, and then you have people trying to go get food, and there's potentially debris and other hazards on the road. That's a different story. But there's still places open. There's still places selling food. That was one of the areas that wasn't under or required to be closed, right? Essential business service.
That's a crazy one, Charles. 80,000 to feed directors, deputy directors, and security at these quarantine and hotels and isolation facilities.
And Adeloop, maybe not Adeloop?
Yeah, we don't know about Adeloop. What do you know about that? So we had asked Carlo, because if we look at the initial email that Hai Hun sent to you, it said there were 20 meals provided to Office of the Governor, but then the policy director, Carlo Branch, had said, oh no, they minus that out, and then we've been paying with private funds. But I didn't get any eyes on anything in black and white that said that. So did you have any insight into that in reading through documents that were sent your way?
Well, I think so. I haven't seen anything, but you would think that meals would have been signed out for. They know exactly what meal is going to what person. So for example, right, there were guardsmen at the Days Inn, right? So they're on subsistence allowance, so they shouldn't have been included in any of the accounts. In any of the feeding accounts, right? When they say they need 20 boxes here or 40 plates here, so it's difficult unless you have that other document that shows who is actually being fed to tell who is fed.
Well, man, we had Mayor Rivera on the other day, and she said that they get there's like all these extra meals at these facilities, and they'll call me up, and I'll go pick them up, and I'll have like 20, 30 meals that we're paying for that people are just not eating, and then she just gives them out to the homeless. So I mean, I don't want to say fraud, waste, and abuse, but it definitely seems like waste. I thought there was supposed to be a hotline at AdLoop that you call fraud, waste, and abuse.
I mean, yeah, normally that's, I would think that's like the, well, in the Army we call them Inspector General, but, you know, the...
Can I just get clarification on what you said a little bit earlier? You said that there were purchases that were made in accordance with proper protocols that Civil Defense did handle?
Yeah.
Okay. What were those purchases?
So first of all, it's easier just to explain the process of how resource management works during an emergency. So we have, you know, the Emergency Operations Center. We have all these response activity coordinators inside. And when we need a resource, what we do is we ask first within the government of Guam or our other partners, you know, the volunteer organizations active in disasters, and we ask them, say, hey, do you have this specific resource? We need a truck to transport people, or a van, or a bus, whatever the case may be. And so DPW or GDOE, they'll come back and say, yep, we have X number of buses, we have X number of vans, you know, GRTA. And from there, you know, we use that to fill the capability and the need. So if they come back and they say we don't have number of buses, vans, whatever for, you know, because they're under maintenance or they broke down, whatever the case may be, or exceeds our capability or capacity, then we go to emergency procurement. And from there, you know, we start to contract out for vehicles if need be, short-term leases, long-term leases. And if we don't have the capability on the island, that's when we reach out to our federal partners and say, hey, we need transportation capability. And however they task that out, whether they task it out to DOD with their logistical assets for transportation, or they bring in, you know, transportation assets. So that, you know, that's the process. So some of the stuff that we've procured using the emergency procurement is, of course, PPE, right? So we've procured quite a bit of PPE. We haven't procured any of the serological test kits.
Right.
We've also procured just regular construction materials. Yeah. Construction materials for, say, the Steamboat Fire Station. They're building out a decontamination kind of add-on to the fire station. And what that's going to allow them to do is decrease the amount of PPE that they currently use, because they just go into to that decon station. You know, they do what they need to do, and then they come out clean, I guess, on the other side.
Man, Charles, I had sent a FOIA your way, and I got the response, and man, it was like night and day looking at how you guys over there are handling your emergency procurement or purchases or whatever you want to call it. I mean, there was like documentation from the beginning, documentation in the middle. They had Claudia Faggi. There was a GSA letterhead on GSA. You know, all the documents and all the ducks were in a row. The I's were dotted, the T's were crossed, and then comparing that with reading the governor's legal counsel's emails and seeing that the way he was handling things, I mean, like I said, it was just night and day. So, Bree, and I got all those docs and what Charles is talking about, all that stuff. I mean, there's just supporting documentation for everything.
Yeah, and you saw it was like probably it
was like 1,000 some pages.
Yeah, it was, right? I mean, it was 70 different purchase orders, and those are 3 to 4 pages long. We had pages of invoices. You know, we had the request to increase purchase orders if we didn't have enough money in these open purchase orders. You saw, you know, 3 quotes. You know, I mean, that's the process. It's a lot of it's lessons learned too, and I say lessons learned because I'm pretty sure that in the history of this agency that you know, something similar was done in the height of the emergency, and at the end when the vendor was asking to be paid, it was just a difficult situation.
Right. You know. Right? Okay. But Charles, so you know the process. You guys procured the PPEs, construction materials. So when all of this stuff was happening with the procurement of these quarantine isolation facilities, didn't anybody with experience raise the red flag and say this is not right?
Well, I mean, I wasn't involved until later on. If you look at the emails, and I have a copy of the emails from GHRA, I wasn't involved in that initial discussion or.
No, but when it was brought to your attention,
I mean, that's when you threw water on the fire. You were basically like, oh, show me the paperwork. And then the whole thing just died, and they took it over to the Emergency Health Superpowers venue.
Yeah. So, like an example with the capital kitchens, right? When it was sent over, we there's nothing we could have really nothing we could have done with it because, there's no purchase order to make the payment off of.
Mm-hmm. So a lot of these quarantine isolation facilities, they are getting ready to expire if they have not expired already. With the anticipation that there may be another surge, we're still in peak core 2. One would think that there may still be a need to have these quarantine isolation facilities in place. And if that is the case, as I understand, there's emergency purchases that might need to be made to keep them in place.
I mean, you basically said a few minutes ago, Charles, that you guys are going to start procuring. Is this new hotels for quarantine or what?
So we don't get to choose the hotel. I don't know. I mean, when I say new hotels, new procurement record, right, for these hotels. So
procurement record.
A procurement record for these hotels. So I don't know if it's going to be the same hotels. Really, we leave that decision up to GSA to award. So it may very well be the same hotels. It may be different hotels. But when we send our request through GSA, we're asking for capability, right? So we say we need X number of rooms for quarantine, and they say, okay, we are going to look at what's available through hotels, housing units, however they're going to get us these 200 some rooms.
So that's what we're looking at, is we're trying to secure 200 rooms for a quarantine isolation facility.
So given the latest, the numbers that we've had, like the last number I received is we're occupying 183 rooms for quarantine. So, we want to make sure we have at least 200 and 250 rooms available, especially once they start opening up flights and we continue quarantine operations, then we're going to need to be able to house these people. And I'm pretty sure, public health, they're going to take a look at their criteria for who needs to be quarantined and how long they need to be quarantined. But as of right now, it's 14 days mandatory quarantine for all arrivals to Guam.
So, Charles, again, just to go back, what it sounds like is we're starting all over and doing it the right way now.
Correct.
So because those contracts, they had that provision that you could extend it, I believe, for 1 month, right, for 30 days or something like that. So are you saying that we're not going to be extending any of those unsigned contracts?
No, we're not. We're working through GSA for contracts for quarantine and isolation facilities. And so the entire process is handled through GSA.
So this sounds like a redo.
Or just starting fresh, right?
But I want to ask because just because you didn't do something, you still tried to do something. So I don't know how I would categorize it, but it kind of seems like they were trying to go around things and then get it over to you and let you put your signature on it, and then we're good to go. But then when that didn't happen, they're like, oh, no, we're going to go over here. So I'm just wondering, it kind of seems like there was a knowing attempt to get around known procedures. And so I wonder, again, I'm not a lawyer. But
neither am I.
I know, but it just seems like just because you didn't do something to get away with it, you still attempted it, and it stopped when you were just like, I'm not signing it. That's how I see it. Is that a reasonable interpretation of events?
Yeah, like I said, they've never asked me to do anything illegal. They've never tried to force me to sign any documents. And I've just given my I don't know if interpretation is the right word, but I've given my interpretation and advice of how I understand the process. And so I can tell you that right now we're working to procure these quarantine facilities, isolation facilities, and we met with the chief of staff. We met with the chief procurement officer. Public health was there. I think it was like 2 days ago that we met, and we laid out the process that this is what we're gonna require in terms of a hotel quarantine facility or a quarantine facility. This is what we're going to require in terms of isolation facility. We got public health's buy-in. The chief of staff, acting chief of staff, John Jr. Calvo, was leading the meeting. And, GSA was there and they concurred. And, I said during the meeting that, please do not go straight to GSA and just work everything through our administrative service officer, Marie Kenga, right? Mm-hmm. Because, you don't want anyone to mention any specific product or brand name because, it can potentially muddy the waters. And now we're, once someone contaminates it, right, it's really hard to go back, right? Because you don't want the perception that someone's influencing the procurement process.
And so would the perception be, and it's kind of a stupid question because I read all the emails, but would you say the perception was that the Adelup legal counsel was muddying the process and tainting it?
Well, I wouldn't say that only because, GSA wasn't part of that process, right?
Right. And so is the legal counsel still involved in this redo?
So, the legal counsel will always be there to provide advice and guidance and, if needed. But, no, at this time, the effort's being led by the acting chief of staff.
Man, Charles, how was that? Was it like, did he try and get in the meeting? You're like, no, man, you screwed this all up, dude.
No. Nothing like that. Yeah, okay. It was the acting chief staff that called the meeting.
Okay.
And it was a productive meeting because we had a couple of courses of action and we said, hey, how about do we lease the entire facility? Do we lease floor by floor? Can we mix isolation and quarantine facility? Because there's the part of the process where we do need to do what we need to make sure that we procure these capabilities to save lives, right, or potentially save lives in the future. But there's also the public administration side of things where we have to be, fiscally responsible, right? And I can tell you that that when it comes to, keeping costs down, and Lester Carlson, I swear we talk almost every other day, and he's a hound dog. When it comes, if he sees something like a questionable cost, he will question it, and he's been very good about that.
Okay, so fiscally responsible, yes or no? Pac Star Quarantine Facility, 389 rooms that we're paying for, even if they're vacant. Yes.
I would have done it different. That's all I could say.
Wyndham? Yes or no?
Yeah. So like I said, I would have done all this different.
Right. Yeah. We got it.
Yeah.
Oh, what about laundry services and feeding? When you said there were different courses of action. So we're going to go into the possibility of doing these new quarantine isolation facilities.
I don't think feeding would have. If it, like I said, if it went through Lester, I don't think feeding would have been approved.
Okay, right. but going forward though, are we going to be providing feeding
for the staff?
No, we will not be providing feeding.
Sorry, cabinet, no more catering for the cabinet.
Will we have cabinet members manning the quarantine isolation facility, or will we be having maybe like the National Guard?
We will be requesting for the National Guard for the management of these facilities, yes.
Can we just clarify with the National Guard, are they 100% federally funded under this state of emergency or the President's declaration?
They are. So they're under what's called 502F. And so they actually received an extension to June 24th.
God, how did the people who handled this first round not know all of this stuff? That's insane. You're describing a completely different course of action that just makes so much sense compared to what we just went through. I mean, we're at the tail end, knock on wood, of this pandemic, and now we're going to redo things, and I just don't know, how do you get up at that level
expire
and not know, like, hey, you can call the National Guard, or hey, you're not supposed to feed the cabinet, don't cater the cabinet.
And a lot of it goes back to not knowing until we know, right? So if we knew earlier that there were meals being procured, then probably would have stopped a lot sooner. Maybe I don't know. But I know once we knew, we stopped it only because we can't pay the invoices out.
Right,
and purchase order.
I feel like Gov Guam. If what if Ed Byrne was like, no, I don't think I should pay that, and these vendors took the government of Guam to court? Would they even have a validly enforceable contract to take before the judge?
Yeah, and so I mean, I don't know, and maybe the question is a bit rhetorical, but
right, yeah. It was.
Yeah, and so it's so if you look at Claudia Faggi, the chief procurement officer, she's a classified employee, right? And she's I'm a classified employee, and and there are certain positions that are classified for a reason, right? Because you want to make sure that they operate without undue influence or fear of potentially losing their jobs, I guess. And I can tell you that there has been no undue influence on Claudia or myself.
Okay.
To do anything legal.
Right. But had you signed those documents, Charles, that they had sent over to you to sign, in your mind, would it have been illegal, or would it have just been not reimbursable?
Well, I mean, if they try to force us to sign it, then we're going to have some issues. But given how novel this event is, it's really hard to tell, because a lot of the rules are not being I'm talking about on the FEMA reimbursement side. A lot of the rules are kind of, the guidance kind of changing every so often. We get a new COVID-19 update on the public assistance program of what's potentially reimbursable or what's not. Non-congregate shelters, we've never used non-congregate shelters for an emergency or disaster before. We've always had the use of gyms and other open shelters, but because of the need to have people socially distanced and isolated, FEMA went ahead and they approved non-congregate shelters for folks to use. And so that's basically what the quarantine isolation facilities are. They're non-congregate shelters.
Mm-hmm. But they also, in that PA, it does say that you have to have records, show how many people are in the hotel, who got,
Correct.
How many people got fed. It's like at the bottom. I think it's under one of the. No, actually, yeah, it was one of the letters that I saw from Mr. Fenton.
Yes, and it shows. It tells you what's reimbursable, what's not.
Mm-hmm.
And it's so in terms of like leasing an entire facility, you got to think for isolation operations, right? It's kind of hard to lease a couple rooms or lease an entire floor. So, we will probably be asking for some sort of exception to policy or some alternate project to see how we can get the lease for the entire facility reimbursed. So it's not dead in the water.
Okay.
But based off of what's in the current policy, they're only when I say they talk about FEMA's only reimbursing for residents of Guam who are returning residents of Guam, and they're not reimbursing for federal employees, DoD employees and their dependents, or anyone who's coming to Guam in a non-resident status.
Mm-hmm.
And that's why the initial guidance was that if you're coming to Guam and you're not a resident of Guam, you'll be required to pay, was it like $225 or something like that?
I'm not sure.
Yeah, but there was the guidance in the beginning that was requiring non-residents to Guam to basically pay for their stay, lodging and meals.
Mm-hmm.
I guess that's a deterrence, right, to prevent visitors from coming to the island.
I don't even recall seeing that. Did anybody pay $225?
I don't know.
Oh.
I don't think so. Charles, what about for example, like the example, Pacific Star, big hotel, a lot of rooms. We're not even using all of them. We're being charged $100 a pop. Moving forward under the real way to do this procurement, how would we acquire the services of a hotel and not have to pay the full clip for 100 empty rooms? Is there a way that you work that should have been done the first time?
Yeah. So in the bid specs that we're working with GSA is we're going to rent by floor, and so we're gonna pay for rooms utilized, and rooms on that floor that are not utilized, we'll probably pay for some sort of small holding fee. Right. But we're not going to pay for unserviceable rooms. We're not going to pay for any rooms that don't meet what's in the scope of work.
Mm-hmm.
So, for example, if a room has mold, we're asking for a clean room without mold, or if the AC is not working, or anything that we asked line by line, we're not going to pay for the room. And they can. That's just that's part of the process, right? It's whatever's in that purchase order. If you don't follow the scope of work, then we're not paying for it.
Yeah. So I want to ask. We had spoken to countless people who are quarantined at the Pacific Star Hotel. We've seen pictures. I mean, the rooms, the individual air cons, mold, the fixtures falling apart. Had you been involved from the get-go with the Pacific Star, would you have would you have approved something like that?
He didn't.
For them to stay in those rooms?
Yeah, you saw. I mean, I'm sure you've seen it all over social media. The condition of these rooms. I mean, it's a bad deal.
Well, so I can't speak about the facility or that, but like I said, if there was a scope of work and there was a purchase order that stated that we're only going to pay for rooms that were mold free or clean, then I mean I don't know why we would put those people like that in those types of rooms, but definitely shouldn't pay for it.
Mm-hmm. So how soon are we going to be looking at a new emergency? It's going to be under an emergency purchase to be approved for the upcoming new quarantine isolation facility. And is it going to be one or multiple quarantine isolation facilities?
So it really depends on which hotel's GSA awards. But we gave the bid specs. Public health. We had Chima from Public Health there give his input. So for example, if we do get one facility, then we have to make sure that isolation is kept in a separate wing, not necessarily separate floors. And so this may be one hotel or facility. This may be multiple. And so it really depends on we have to work with what's available, right? What's available, and then of course what's whoever's awarded.
Okay.
Well, I feel like it's going to be a little awkward for you around the office today.
No, I mean, I'm here to I'm here to support everyone.
Right. Yeah.
Right.
Yeah. Well, we definitely appreciate your candor and your honesty and really the insight that you provide in this, because sometimes it's hard to pierce that veil, you know what I mean, and to get to the real transparency.
I mean, if we have documents and we're FOIA'd, then we're going to submit what we have.
Right.
I got to ask though,
Yep.
Based on your experience and emergency and disasters that you've responded to as the Civil Defense Administrator, I want to say, is it close to 10 years? How many years?
No, I've only been here for 5 years. But a lot of when Governor Calvo appointed me, a lot of my so when I was appointed, I was 32 at the time.
Mm-hmm.
But I had an extensive military background, and of course, education-wise, I was a doctoral candidate. Mm-hmm. Still am, by the way. Okay. Finished one day, but it was a combination of I think experience in education, and
mm-hmm.
I hope I did right by the last administration, and I hope I've continued to do right with this administration and provide just it's the best advice I can give.
Mm-hmm. Well, like I said, having all this experience, I know we worked storms with you for several years, and when this all came up, and the fact that you did do emergency purchases with the PPEs, when this all came up with the quarantine and isolation facilities, the laundry services contract, the feeding of cabinet members and Adeloop staffers, were you like, what the hell? Or thinking in your mind, like, what is this? And this is not going to fly?
What manner of trickery is this?
Were you shocked? Oh, sorry. Were you shocked?
Well, I wasn't included when I say from the get-go. And from the get-go, I'm talking about a lot of stuff prior to the actual emergency. I just wasn't in the loop.
But shouldn't you be in the loop when you're the Civil Defense Administrator?
I agree, but I just, for whatever reason, I was in the loop. I have a colleague of mine. Her name is Wendy Smith-Reeve, and she was my counterpart over in Arizona. And so she actually resigned in the middle of the emergency. She just felt that, her role as the state EM director wasn't being utilized. They didn't follow processes. And, I'm just fortunate that when the governor actually declared a state of emergency, that we actually implemented the comprehensive emergency management plan. And the cabinet, they've been very good about ensuring that they utilize their response activity coordinators versus director to director type of coordination, because if they utilize their response activity coordinators, which they have been, we have a system of record. We have you can see who's touched it, where the resources are coming from, timelines, and all the processes that go into getting resources. Mm-hmm. My role is I'm a coordinator, right? So if they ask for something from us, then we're going to do our best to get it.
Well, it's reassuring to see her in the loop now. So
yeah, and this is the first time we've had major disaster or emergency like this, right? So it's.
Charles, I feel like they're a bunch of newbies, and I would have been like, hey, who knows how to do this? Can you help me out here? Because you guys they just got in office. Legal counsel is so green, a lot of green people there. So I don't know why they didn't say, hey, give me a hand here.
Yeah, and so I've given inputs on several different issues, and I've given input on what's potentially reimbursable and what's not, specific processes between us and FEMA. So it's just for some reason it's been hit or miss.
Mm-hmm. By the way, who's staying at Perlis Court?
Yeah, what do you know about that? 17 fully furnished condominiums. I don't know. We heard it was. Go ahead.
Perlis Court was not coordinated by us, so that was for medical staff. For I believe I want to say GMH medical staff who were when they had the COVID-19. I remember when they had the positive person over in GMH.
Right.
So med staff were staying there to prevent decontamination.
I want to believe that, but I kind of can't help but think, are you sure Tony Mabalta wasn't crashing there or something? Or was that the love pad or, you know what I mean? Because it's 17 fully furnished condos. Come on.
Well, for that, I asked a couple of days ago just for the list of people staying there. So, so there is a list of people who have been staying there.
Can you provide that to us?
Yeah, sure.
Okay.
No problem. It's med staff, right?
Okay. It's the medical staff. Okay.
Yeah.
Yeah,
and so they were staying between Perlis Court and the Wyndham. But in talking about procurement, medical staff lodging is something that we are working with GSA to procure, and they will more than likely probably stay in with the quarantine folks in the facility, mm-hmm. or isolation folks.
It just seems kind of random, this whole Perlis Court thing. I don't know how because they're not a GHR member, so again, I don't know how they got folded into the conversation. But are you guys so that's gonna get scrapped, basically, is what you're saying?
Correct.
Okay. I think all of the Pac Star, Wyndham Days, and Perlis Court is
out of here
because they're starting from scratch.
Man, the cabinet's going to look back at this time, man. They're going to be like, man, that COVID, remember that? We're getting that COVID pay. We're, working in the hotel. We're getting the meals, man.
Stop.
Sorry. That was rhetorical, Charles.
Got it.
Okay.
All right.
Yeah, appreciate it.
When's your next meeting? Are you guys is this pretty much done, this plan, this course of actions that you guys have listed that I'm looking at?
Yeah, so we met 2 days ago, and then that list of future actions that we're going to take, that's from a meeting with GSA.
Right. I saw that there was something in there about stop the bleeding.
Yeah.
Yeah, we were going to get that.
No, that's just a nickname I gave to current items. So.
Yeah. Charles, what about the federal authorities? I mean, there's been rumors going around when they see stuff like this. Is this something that they, maybe go pay you a visit or anything? Have we got any info on that?
You're talking about which federal authorities, like FEMA or?
I mean, any FEMA, the other
big federal
the big
authority.
ones, all the federal authorities that start with an F. Let's just put it that way.
Yeah, no.
Might end with the I.
No, so no one's paid us a visit. And FEMA, they are here to support, and so they never get involved with local matters, local politics, local operations.
Right.
They just want to make sure that everything they do to support us is, follows a federal process.
Right. Well, we're gonna let you go. I know you got some stuff to do. I'm pretty sure you're gonna be feeling some eyes burning in the back of your head. But hey, it's good to talk to you. It's good to shed some light on this.
Sure, not a problem. Anytime.
Thank you.
Okay, thank you, Charles.
I appreciate it.
Of course.
Take care.
Agamos, wash your hands.
Thanks. Bye.
9:37. Oh my goodness! Did you guys hear that? That's pretty huge. I think it's pretty huge. Thank you to Charles Esteves for shedding this light on now. I mean, the takeaway is that we are redoing everything,
Starting new.
and the correct way. That is a huge malfunction, if I could use that word.
Mm-hmm.
I mean,
Yeah. I mean, if you see the contracts, they are on the governor's website. It tells you, what these hotels are supposed to provide, what the government. They didn't even sign it. So Charles Esteves' signature is required. The AG signature was required. BBMR signature was required, and one of them, public health signature, was required. Who else? Oh, and the governor's signature. But it wasn't signed. These contracts that are posted on the website. But what was attached was the memo dated May 8th, signed by the governor, that explaining that she has these special powers under Title 10.
the Health Powers Emergency Act. Okay. So, what I thought was really key there, Bree, was when we asked him if you had signed those documents, would you have been doing something illegal? And he was basically like, I didn't sign them, and if they had forced me to sign them, then yeah. Pretty crazy. 9:39. We're going to take a little break. I just need to do some deep breathing after that interview.
Why don't you play that video?
Oh, yeah, we got this this is a cool one.
Yes. My friend Brian Terlahi.
Your friend?
Yeah, he's a great guy.
He is, man. Johnny in the house.
Yeah. He sent a video last night, and he tagged me, and I posted it online. It's his organization, Guma Rasan Achulati. I probably said it wrong. And a couple of other Gumas from, I believe, Japan. Trying to find it. Here it is. It's Guma Rasan Achulati, along with Guma Imahin Tautau Lati from Osaka, Japan, and Guma Famaguun Itanu Zen Itasi from Tokyo, Japan. We have the video?
Yes, we do, and we will play this right now, and it's containing COVID. The KUAM News Takeover, Guam's favorite, I-94. Good morning.
During these unprecedented times, we, the members of Guma Rasanatsu Lati, and many of our brothers and sisters in Japan, would like to send a message to everyone on our beautiful island, as well as the rest of the world. We would like to bring the spirit of our ancestors into our hearts and minds to continue to bless and protect our every well-being. Let us continue to stay strong and remain peaceful with each other, sharing in the values of inafamaulik and respeto passed on to us by our elders. Nihi tafan amedgut za tafan afamaulikhit guihi na tiempo. Nihi ta kontinuha promotehi ifamagoonta za nespishat imanyay nata. Especialmente nihi tafan kontinuha mo na ikinalamten ilina lota zata na medgut hit para imamayla siya na tiempo. Por favor, tatizi todo itinatizi gininiman maagasiha. Por favor, continua mamagasi ikanaita. Por favor, continua munagasgas iurizata. Zan por favor, konsigi mo na sumaga gihalong igimata. Nihi tagagaw i bendisyon gininimanyay nata, zan si zuustata. Nihi tagagaw lokwi i promotehin islata ginina Santa Marian Kamalun. Nasafu hamzu mo na fan met good hamzu. Nihi zatafan hatsahit na tsamoru. Biba tsamoru, zan biba gwahan. Si zuus maosi, gininigima rasa natsulati, zanimanye luta siha.
Brian Terlahi.
Thanks, Brian.
Guma Rasanatsu Lati there. 9:45. We'll take a little break, and we're going to share with you some comments we got from the Office of the Attorney General on whether or not he is conflicted due to relationships he may or may not have with AdLoop staff. That's coming up 9:45. It's the KUAM News Takeover, Guam's favorite, containing COVID. Good morning.
Is still serving the subs.
Be healthy. Be informed with ITD.
morning. Let's go over to the Guam Humanities Council where we got Kim Kaling on the line to talk about. There's some great CARES Act grants that are being made available, and we want to find out more about that. Kim, good morning.
Hey, good morning, Chris.
So we'll just give you the floor. Tell us about the grants that are available through the CARES Act and the Guam Humanities Council.
Yes, the Humanities Council was very fortunate to receive funding from the National Endowment for the Humanities through the CARES Act in order to provide cultural and humanities-based nonprofit organizations that are experiencing financial hardship because of COVID-19. And so we're encouraging these organizations to apply. We can offer up to $10,000. And importantly, it's not just for programming, it's all for general operating expenses as well.
And this is so, as an artist, well, I like to consider myself one anyway. What kind of supporting paperwork would you need to have to apply for a grant?
Yeah, so everything will be online. We're going online, and unlike our other grant applications, because we want to try to get this money out as quickly as possible, we've really streamlined the application. So we'll be asking basic questions about the type of organization that you are, right? We'll ask some financial questions in terms of the kind of hardship that you're experiencing because of the pandemic, in terms of like making payroll, covering other operational expenses like rent. The applicants have to have a DUNS number. You need to apply for that if you don't already have it. If they don't already have it, but we can still process your application, and then wait till you get the DUNS number. So basically, it's very streamlined. It's very accessible. So as of tomorrow, 8 a.m., you can go on to Submittable to all of our messages that you have, the received, and just apply online.
All right. Sounds great. Can you just give us an idea, and I don't know if you want to be specific or general, of what types of groups and organizations, like, just give me an example that would be able to avail themselves of these grants?
Yes. People get kind of scared off when we say humanities-based organizations,
right.
But right, they're like,
the HBOs.
So basically, it would be organizations such as Harao, Nihi, some of the cultural dance groups that we have on the island, some of the seafaring societies who are incorporated. I could think of like Manelu, some of the programming they do is culturally based. Hadza, the Hadza Foundation, that focuses on Zoamti, right, the traditional healing. So, many organizations could be eligible to apply.
That sounds great, and it's going live at 8 in the morning. How much in grants are available, and is it because and I don't know how relevant this is to compare it with the PPP Small Business Administration Program, but what we saw there was there was such a great need that the funding ran out.
Yes. So what we're going to do is that's why we're going to start open applications on the 15th, and we'll continue to accept them until October 1st or until our funding runs out. We were awarded from NEH over $200,000 for the grant program. So we're hoping to get as many applicants as possible. Unfortunately, we can't fund everybody that would be eligible. We want to try to fund as many organizations as possible, and giving up to $10,000 I think would be
that was going to be my next question, was what's the grant amount? So it's up to $10,000.
Right. Yes.
Okay.
Yes. And no matching funds are required. A lot of times with these federal grants, you have to have in-kind or cash matching funds. But what's important about this, there's no matching funds that are required, so you're just awarded the money to do your programming or to cover operational costs.
All right, so I just sent a mass text out to all of my cultural advocates. Hey, let's get on this grant tomorrow.
Thank you.
You said 200,000? Is that what you guys were awarded?
Yes, a little over $200,000. I think it was close to $250,000.
Okay, so you're looking at about 20 grants.
Yes, we're hoping to get, yes.
All right, Kim, thank you. And, keep us in mind anytime you got anything going on, especially now that we're kind of winding down from, the big part of the COVID response.
Yeah.
We're anticipating that you guys are going to start doing more things or finding ways to do more things, right?
Yes, we're doing a lot of virtual programming, so stay tuned for that as well.
Thank you, Kim. Thank you very much.
Okay, thank you so much.
We'll see you.
Okay, bye-bye.
Wash your hands. Okay. 9:52. So, yeah, we're going to close on a good note here in a second, but just wanted to kind of share with you guys some news that we got out of the Attorney General's office. And where is that at here?
I can read mine first.
Okay, go ahead. Yeah, go ahead.
So, I was mentioning earlier that I had reached out to the Attorney General's office yesterday about their comment regarding whether or not the AG's signature was required on those agreements, contracts that were sent over regarding the quarantine hotel isolation facilities. And I couldn't get a yes or no answer, but, one of the other questions I asked was, will the AG conduct a review of the entire process and vet it for legality, compliance, and quality control as an independent elected Attorney General? So I just got this statement that, please see the below statement from the OAG on questions related to the documents posted on the governor's website. Guam law affords the government extraordinary authority when responding to a public health emergency, and our office has been actively assisting our client agencies in responding to this unprecedented COVID-19 pandemic. But we all recognize that extraordinary does not mean limitless. Our office will continue to review government contracts and the procurement process for compliance with the law, including the documents posted on the governor's website, but we are unable to comment on the legality of the documents or the process until we have enough time to adequately review them. So that is the statement from the AG's office.
All right, and we used our famed two-prong questioning approach, and I had also sent some questions over to the Office of the Attorney General. My questions were more focused on potential conflicts of interest. So the questions I asked your elected Attorney General, Levin Camacho, can the Attorney General disclose the nature of his personal relationship with Adeloop's legal counsel? Can the AG disclose whether or not he has any family members working for the office of the governor, lieutenant governor? Can he name the persons, if any, he's related to? Can the AG disclose whether or not he has any family members who are members of the Leon Guerrero Tenorio cabinet? Can he name those persons? And then lastly, can he address whether or not he believes the relationship he has with the Adeloop legal counsel and or having any close family members who work for the administration prevents him from being an impartial check and balance on the executive branch as an independent elected Attorney General? And let me pop
you
up
got a response?
I did, yeah. So, and I had asked this question before, but we didn't get the answer. So, sir, you got that? Yeah, we'll pop that up here. And the response from your elected Attorney General, and this is specifically on the question of can he disclose the nature of his personal relationship with the Adeloop legal counsel? And he writes, I am friends with Hai, but I still have difficulty spelling his last name. This relationship does not impede my ability to fulfill my duties as the Attorney General, whether duty calls for taking positions in line or in opposition to that of the governor, the latter of which KUAM has documented several times over. I would not allow my personal relationships to compromise our office's ability to independently and objectively carry out its mission. If conflicts of interest arise in our office, any affected employee, including myself, would be excluded from involvement in the matter. And then on the questions that I had sent about whether or not he had any relatives working at Adeloop or in the cabinet, the response was, I do not have any family members working for the office of the governor or lieutenant governor.
What about the executive branch?
I asked again, and then I sent this over to Carlina after we got the answers to those questions, and I had put, does the Attorney General have any family members working in executive branch line agencies? However, we didn't receive a response. But, if he does, and let's be real, it's all over social media. If he does, I feel like if the media is going to ask you, hey, are you going to know anybody in the administration that, is a potential conflict, you're related to anybody, would you maybe just go a little extra with the disclosure and be like, yeah, I don't have anybody working at the office of down at Adeloop, but I do have someone who's in this agency and that agency. That's how I feel I would answer the question.
Right, but these are unprecedented times.
It's rapidly evolving, Sabrina.
And that's the thing now with the media. They have to word the FOIA requests specifically and in certain ways so that you can get, and maybe not even specifically, but broadly, just to try and get an answer, because we don't know how they're going about doing whatever it is they're doing, like
Right,
with the electronic
Fund
transfers,
transfer,
we'd ask for checks, and they weren't checks, they were done electronically, so hence there were no checks.
I'd also sent an email yesterday to Administration Director Byrne. He was on the show, and definitely thank him for his time and all that. But he had said that in your story, the governor gave him the marching orders to pay the thing. So I'd asked him, which invoices did you pay today, and how much was paid at the instruction of Adelup and their COVID-19 memorandums for emergency purchases? We haven't got a response yet on that. So I don't know. Maybe they're in the process of being paid, or I don't know.
No, he said they were going to be paying them.
Yeah.
And those contracts do, like I said, they expire.
Yeah.
Some have expired, and some are just a few days away from expiring.
But as we heard with Charles Estevez, they're starting the whole thing over, and they're going to do it right, It's like that old song, baby, take your time, do it right. 9:59. Let's go to the phones. We are going to end on a good note. Yes. You ready for a good? Yeah, so let's get Cyrus from Guam Animals in Need up on the show. Cyrus, good morning.
Cyrus.
Morning. Thanks for having me.
Of course, our pleasure. So we just wanted to highlight some of the things that you guys are doing over there at Guam Animals in Need. So we're going to pop the pictures up while you're talking. Just run us through some of the efforts you guys are doing to assist those less fortunate during COVID-19.
Well, I appreciate that. And I think there's like three things that I can highlight. One is we're doing a GAIN pet food bank. And so we've had a lot of people reach out to us. I mean, everybody is going through a tough time at this time, and we're recognizing that people in our community are struggling to make ends meet. So we're trying to help as best as we can. And so this past Tuesday, we set up a temporary pet food drive at a few locations around the island. We were able to collect donations, and then a couple days later, we provided some free dog food to families that are going through a difficult time right now, because it's not only ourselves that are people are going hungry, but also some pets as well. And so this was a way that we thought we could kind of help the community, help each other, and so that's what we did this past week. We would like to repeat it at least a couple more times, kind of test this moving forward. It's probably, unfortunately, not something that we can do indefinitely, but we definitely want to do everything that we can to try to help. And so if people want to follow us on social media, they can see when our next locations will be. It will most likely be this upcoming Tuesday as well. And if anybody does need assistance, please contact us privately through social media. Guam Animals in Need is how you can find us both on Facebook and Instagram, or you can give our coordinators a call at 487-4845. That's a cell number, so you could also WhatsApp us at that number. And so that's how we're trying to help people out who are donating pet food to the community. And then we also wanted to highlight the fact that we have some wonderful foster families who've at this point been taking in animals for almost 6-7 weeks. So when COVID first really started, when the movement restrictions for public health reasons were implemented in March, we evacuated our shelter. All of the adoptable pets, we put them into foster homes because that would be the safest way to take care of them during this interim period. And so we've had over 50 families on Guam, well over 50, I should say, take in these pets and provide them loving homes for the last 6-7 weeks. They are really heroes. We want to highlight their good work. And in the near future, we'll start bringing them back into the shelter and making them available for adoption. But I think the really wonderful thing is that we've been able to do adoptions remotely during this period. So all of our animals are on our website, guamanimals.org. People have checked them out, and we've actually done about 15 to 20 adoptions just over the last few weeks completely remotely. Families are sharing the videos with each other, and then we safely manage a transition of the pet from one home to another. And so this is another example of just the community coming together and really helping each other out.
Well, Cyrus, we just wanted to get you on and share the good works that you guys are doing there for people during this COVID-19 pandemic, and to let you know that you and the folks over there, Guam Animals in Need, are COVID heroes.
Thank you.
And I know you're doing a lot, so anything else that pops up that you're doing to help, you just give me a holler, and we'll get you on the show, okay?
Okay, thank you so much.
Okay,
right,
Cyrus.
take care.
Wash your hands.
You too.
Okay.
Will do.
Okay, bye. 10:03. Well, there you go. It's been a good time with you guys. To all of our viewers on KUAM TV 11, thanks so much for watching. There's an audio stream, Docomo Channel 10. Again, thank you guys. The KUAM.com, the KUAM News app, and our KUAM News Facebook live audience on our Edward R. Murrow award-winning social media.
Excellence in social media.
Yeah. So.
You know, before we go, I wanted to just remind people that tomorrow is the deadline to apply for the Procurement Salapi Azuda ni Tautau program. There's $20 million that the governor set aside in disaster aid funding.
Right.
So if you can, go to dphss.guam.gov, click on the Procurement Salapi Azuda ni Tautau, what is this called?
Link.
Tab. Yeah, tab and apply.
There you go.
It's different from the SNAP one. This is a new one, and it's not as extensive as the SNAP one. This is like 5 pages as opposed to the 16.
Right.
So yeah, apply. Tomorrow's the deadline.
Okay, 10:04. Bree, good job today.
Good job.
And good job to you guys. Thank you so much for having our backs. Have a great Thursday. Remember, there's a press conference, so meet us on our KUAM News Facebook page, 2:30. Big announcement. Adeloop's got something big to announce for you guys, so we'll see you there. Guahusi Chris. Hasta. Adios.
Bye.